dreaming of one day to become a physician. Back then, I thought I understood what becoming a doctor meant, and I thought it was about getting good grades and getting into medical school and passing boards exam and matching into residency and eventually learning how to operate. So while all that are important today, I want to focusing on talking about lessons that I learned beside or outside of the operating room and everything that come in making of a surgeon or a physician. So why don't we get started? I briefly talked about this slide earlier that initially I thought I understood of what becoming a doctor meant. All these things, good grades, getting into med school, passing exam, matching to residency, and learning how to operate. But the harder part about becoming a doctor or a surgeon is becoming the kind of person that patient trusts on the worst day of their lives. And today, I don't want to give you another presentation about how to get into medical school. There are already plenty of people out there who can teach you how to build a strong application. So, like I say, I want to share what residency has had taught me about becoming a surgeon, not just inside the operating room, but beyond it. Okay, so let's see. Let's start with a question. Raise your hand if you ever thought about becoming a surgeon. Okay, I'm seeing quite a few of you. Okay. And then keep your hands up if you think surgeons spend most of their day operating. Okay, I see 63 of you. Okay. So let me tell you a secret. We actually spend far more time thinking than actually operating. Let's see, come back here. Yep. So before every operations, we tend to ask ourselves a series of questions. Does this patient really need surgery? Is surgery the safest option? Are they healthy enough to tolerate surgery? What are the risks? What are the benefits? And what happens when if we don't operate, right? So these questions are often harder or to answer because those are decisions that you have to make before you operate. And technical skill can be taught, but judgment takes years and years to develop. And that raises an interesting question. How do you think surgeons develop that judgment in the first place? And we're going to try something together, okay? So imagine that you're in the emergency department and a patient comes in with severe abdominal pain. What would be your first move? We have three options. One option is you can think about we can if you want to do it like a CT scan, or are we going to do surgery right away, or are we going to do a physical exam? What do we think we should do first? That's good, physical exam. Okay. Now, when you do a physical exam, when patient come in with an abdominal pain, there's so many things that they would have, and what you would ask them for is any associated symptom that they might have. They might have like nausea, vomiting. They might have, and then where is their abdominal pain as well, right? Because a lot of that change what would be the next step that we would do, and depending on whether or not if they're pregnant or not as well, it would change the imaging modality that we would use at the same time. So all that just to say is um, this exercise that we just did, it wasn't really like a test. All that, I just wanted to show you guys that medicine, it isn't about memorizing what's the next step is, what is the right answer. It's about asking the next best question for the patient that is in front of you. And that is what we call clinical reasoning. Because every patient, when they come in with a different story, and they might be 25 years old, or they might be 65 years old, they might be 90 years old. I had a patient the other day who came in with abdominal pain with and they are 95 years old. So different patients population, we um, make our clinical reasoning, we examine them, we do physical exam, and we come up with a clinical judgment that is specific to that population. And so our job is to organize their story into different possibility, not what diseases this patient have, but what could this be? What diagnosis can I afford to miss, and what information I'm still missing? So medicine is really, it's rarely black and white. It's really about navigating uncertainty while making the safest possible decision. And that's why your science classes that you're taking right now really do matter. Not because you will memorize every single pathway forever, but because they will teach you how to think critically. And while thinking is essential, no, no surgeon or doctor or physician will ever practice medicines alone. And that is one of the next big lessons that I learned during residency is realizing that surgery is one of the most team-oriented specialty in medicine. And that is similar across the board, no matter which specialty you are going into, because saving life is require multiple discipline. And currently, I'm on trauma surgery right now. And when a patient came in having or sustaining a trauma, we have emergency physician in the room, we have trauma surgeon in the room, we have nurses, we have pharmacists, we have somebody running to get us blood. So it's really is a team sport. Okay. And every successful operation is really depending on everybody working together. In the OR, we have the scrub tech, we have the anesthesiologist, we have the PA, the residents, the medical student, and many, many other healthcare provider in the room. So no one really saving lives alone. And in fact, some of the best surgeons I've worked with weren't really necessarily the fastest or the most technically gifted. They were the one who stayed really calm. They communicated very clearly. They listened to what everybody has to say in the operation. They respected everyone in the room. And that's the kind of leadership that I want you guys to start thinking as a pre-med, because when I was a pre-med, there were so many requirements. They talk about volunteering, they talk about being a lead, taking leadership position. And truthfully, now that I look back, all of those requirement quote quote is really to build the skill that you need once you become a physician, a surgeon. You will have the ability to lead the room, to be in charge, and to know how to delegate tasks and be an effective leader. Okay. And this tie back to the whole idea of this whole presentation is that the quality that develop, the leadership, the compassion, all those qualities, they are not developed in the operating room. They are developed through experience, and that's why as a pre-med, I think it's very helpful for you guys to gain these experiences outside of your classroom. Okay. And then the next part I want to talk about is the hardest part of medicine. I think this is one of the common questions that I get from med students or pre-med student. They ask me what is usually they ask me what is the hardest surgery I have done. And truthfully, the hardest part of residency medicine, it isn't about like learning the hardest surgery. I think the hardest part of medicine is about learning who you become under pressure. And most of the day, you'll be tired. You will be working long hours. You'll be working through nights. And sometimes patient may or may not improve, and complications might carry with you forever. And sometimes you might receive negative feedback or what we call constructive feedback in moments, or there are moments that you are wondering if you're good enough. Like I have, sometimes I have those moments too where I questions if, if I'm good enough. And so, and on top of all of those pressure, I also moved 2,000 miles away from my family at the beginning of residency. And early in life, when I was 13 years old, I migrated from Vietnam to the US as a teenager. And so I had to learn a new language. I have to adapt to new culture and figuring out where I belong. And so looking back, all of those experience, all of those challenges that you have to overcome before you even step foot into a medical school, those experiences are actually valuable because it will prepare you more than you will realize. I think when you are in residency, when you're being put under pressure, if you develop the skill and the strength, and the courage that you had from overcoming the challenges that you had in the beginning of your career, those characteristics, the grit is what we call, and the perseverance, those will help carry you through residency and all of the difficult and challenges that you will face as you proceed further with your career. All right, then this is something I want to also talk about too, which is motivation. So motivations, it does comes and go. And someday you might wake up and you might feel very motivated and you feel like you can tackle anything, in the world. But some other day you might wake up and the only thing you want is to catch up on sleep and relax, right? So what I'm trying to say is, don't depend on your motivation, to get things done, because it comes and go. What you should do is try to create a system, that works for you, your study habit, how you organize your notes, how you organize your day. If you create a goal, if you set a goal, create a system to where you will complete that task. Um, for example, throughout my day, I would wake up at like 4:30 in the morning, and I would go to work at around 5:30 a.m. to be there, for a pre-round my patients. So I know that in the morning up until maybe noon is where my brain functions the sharpest. And so throughout that time when I'm off, I would try to organize the tasks that require a little more of my brain power, a little more critical thinking, like research, um, during the beginning part of the day. And then around 7 or 8 p.m., that is when my brain is actually exhausted. So I would save the tasks that require less critical thinking, such as scheduling for the next rotation. Now that I am moving up in the residency, I'm responsible for creating schedule for the junior. So that is something I can do without having to think about, the logistic too much. Or organizing, tasks for the weekend, coming up with a to-do list or do laundry and other things that doesn't require me having to think or using my brain power so much. And if you create a system like that and you know yourself, you know when you are the most effective and when you're not, and then organize the tasks that would require the appropriate amount of your brain power into it. So every day, even when you're exhausted, you know that at least there is still something that you can accomplish for that day. Um, and that is how I organize my day, and that is a system that I built throughout my career because I don't I don't feel motivated the whole entire day, and I don't feel motivated 7 days a week. So it's really important for you guys to come up with what works for you and what would be the most efficient for you to get your things done. And so that and getting things done will help you take one step closer to your goal. Okay. And the other things that are also important is taking time out for the people that you love. I think this is very important for us high achiever. We like to get things done. We like to accomplish tasks and we like to pursue the next thing the moment we're done with one task. But make sure you take some time out to spend time with your friends, with your family, with your cousin, because those are also important. With even with my busy schedule, I only have like 4 days off per week, per month actually. I try to squeeze sometimes into my schedule. Like for example, if I'm driving home from work, and my drive from home is to home is usually 20 minutes. So I try to call my mom during that time. I try to call my best friends who is like far, far away. I try to connect with the people that I love so that I won't go months and months and months without talking to them. And life will get busy, you will get busy, things will get in the way. But if you just be proactive with keeping touch with your people, there's way to do it. The second part is protecting your health. So this is also important to me because I feel like when you feel healthy, when you eat well, eat right, and when you work out, when you exercise, when you move your body, when you feel good about your body, um, for your mind will be more sharp, will be clearer for you to accomplish the tasks that you have throughout the day. I don't work out every day. That is not possible for me. But what I can do at the hospital is that we have 11 stairs. So instead of taking the elevator up to go see my patient and round my patient, I take those 11 stair up. Just those small things I can accomplish for the days that I can't go to the gym. And those little things that they do really add up. And we do have like a gym in the hospital too. Sometimes if there's a downtime, I try to go in there and get on the treadmill and walk on an incline really quickly. And during that time, I can also call my family, call my friends, at the same time. So I try to multitask and try to get as many things in as possible. Third things is having a mentor or multiple mentors. This is so, so important. I don't think I would be here today without my mentors. And I don't have just one mentor. I have multiple mentor who provide me different advices in my career. For example, back in med school, I have a mentor who inspired me to go into surgery, and I still occasionally message him about the cases that I have today and what we did in terms of the operation for that day and what his thought would be. And so I stay in touch with him. I have another mentor who I have currently at my current institution, and he helped guide me in terms of what would be the next steps to do to pursue my next career goal. So I would meet up with him every 6 months or so to talk about the progress, and he gave me advices about who I should talk to. And he gave me advices on research and which journal I should be looking at and the difference between different journal and what my paper would be most likely accepted at which journal. So I have a mentor for research, a mentor for career development. I have a mentor who just, bouncing idea back and forth regarding a certain case because not every surgery is the same and not every problem is being managed the same way. I think that is something you guys will learn as you progress in your career is that we don't, and I mentioned briefly before too, there isn't really a right answer. And one problem, one surgeon might manage it one way, and then the other surgeon might manage it a different way. So talking to someone I can trust in the area, with the expertise in the specialty, will really give me an insight about, what other possibility, what other way that I can, that could have solved this problem. Because when I become an attending, when I finish all of the training, I will have to come up with my own method of solving problems or doing surgery. And I think being in training, being in residency, having exposure to so many attending, so many way of doing things, it really helped me pick out what I think is would be the best technique or would be the best for the patient or a certain population. So having mentors are very, very important. And how would you stay connected with this mentor, or how would you even find them? I have a couple of students who reach out to me about mentorship, and I personally, when I look for mentor, I also just reach out to whoever I think will be a best fit for me. You want to come up with what you're looking for, right? What is your goal? If your goal is to advance your career in a certain specialty or a certain field, say you want to go emergency medicine, you want to go into like do maybe PhD, or you want a MD PhD, or maybe you want to do something, whatever that you're interested in, go and research and Google. To be honest with you, I just straight up go up and to Google and I look for people. And what I do is I look for me research, say that I'm interested in breast reconstruction. I go into breast reconstruction journal, and then I look for like most most recently published paper, and then I found all these new all these authors in this paper, and I read up on their paper, and if that's something I'm interested in, I would reach out to them and express my interest and tell them why I'm interested in working with them. That method we call is cold emailing, but you also want to have some sort of interest or connection to the person that you're emailing to, so that can increase your chance of them responding to you, right? And once you and be and set your expectation. If you were to send 100 emails out to these people that you think you want to connect, expect maybe 20 emails back, and expect maybe two people or even one people would be interested in engaging in a long-term relationship with you. But I know it sounds tedious, but I think doing that and using that method, it really helped me branch out from the current institution that I'm at. By using that exact method, I have connected with a plastic surgeon who is in Colorado right now, who I wanted to work with one of their mission trip in one of the global surgery project that they're doing. Another person, which is a fellow who also graduated just recently, she is also a plastic surgeon right now, and she is graduated in Boston, from Boston. And I've been talking to her and asking her for advices, and how I can, prepare myself, prepare or gain the skill necessary to prepare me for the next step, which is fellowship. So I do think that it's beneficial for you guys to reach out and find all the connections beyond where you at right now. And I know it's tedious work, but you will be surprised to find the people who actually share a lot of commonality with you, passion, that maybe your local area can offer to you. Okay. And the last thing I want to talk about is interests outside of medicine. Um, Make sure you have hobbies, have multiple hobbies. Right now, before med school, before residency, I have multiple hobby, but now that I'm busy, I can only have maybe one or two, which is okay. You want to keep your hobby and be consistent with it. And you can find new hobby too. Like recently, I found new hobby in gardening, and I start learning about plants, and on my off day, I would go back in the garden, and I have a little tomato plant in the backyard that I'm really proud of. And even though it's only give me maybe three or four tomato every like week or so, so it's not enough to like do like a meal or anything, but it makes me happy to like be able to grow something, see it grow, and then like collect a fruit or like a vegetable out of it. And it doesn't require a lot of time. of my time during the day. So that's something that I've been doing. So for you guys, just pick out a hobby that you feel like you can stay consistent with, that you can do maybe an hour or two every week so that you can feel refreshed, so that you don't feel like you're just being in the grind, like doing the thing every day and getting tasks done and not really like enjoying life. You want to enjoy this process as well. You don't want to just working hard and not also enjoying the process that gets you there. Or, yeah, okay. And ultimately, all the thing I've talked about, the time for the people you love, protecting your health, having mentor, interests outside of medicine, these aren't distraction and they really do make you a better physician because when you feel refreshed, when you feel refreshed and you feel like you're at your best version of yourself, that's when you can help others, right? You want to be at your best self so that you can help other around you. And then this is something I want to talk about too, which is what I wish I knew before going to residency or even before the whole medical career altogether. So, 5 things I would tell myself as pre-med. Don't chase perfection. You can never be perfect. What you want to chase is progress. You want to be better today than you were yesterday, whatever it be. Better at cooking, better at, accomplishing a certain task. If yesterday you got asked a question about, say, for you guys, for your level, Krebs cycle, it's something that everybody talk about. If you got asked questions about the Krebs cycle and you didn't know about it. So today maybe it's a good day to learn and review about the Krebs cycle if it's going to be on your test later. Um, like for me, yesterday, I missed one step during this whole procedure. So it's something that I wrote down my note that this is what I did, and next time, make sure I do A, B, C, and D, and make sure I check A, B, C, and D so that I won't make the same mistake again. So you can never really be perfect. And even with my attending, they aren't perfect either. We are all learning, we are improving every day. So if you want to chase something, chase progress. Make sure you're better today than you were yesterday. And over the years, 10 years, 5 years, when you look back, you see how much you have grown. Second, find mentors before opportunity. I briefly talked about that in the previous slide. And so I cannot emphasize how important this is because the right mentor can change your career forever. Like I mentioned, I had that mentor in med school and he really shaped my career. I started getting interested in it because in the beginning, when I thought about plastic surgery, I thought about cosmetic surgery only. But he really shed light into what really plastic surgery is for me. He showed me, and he's also a hand surgeon as well. And so he showed me how hand surgery can help, give patients back their ability to even do their daily activity, the things that we don't really think about, like feeding ourselves, like using the spoon, using the chopstick, fork, bathing ourselves. We use our hands a lot. So he really gave me or shed some lights into what really plastic surgery is, what reconstruction surgery is, and what hand surgery really, really is. And it gave me purpose. And I find my interest in that specialty. And he has been shaping my career ever since medical school. And then along the way, you will pick up more mentor. You will find people who advocate for you, people who make a phone call for you to med school, to residency. And I think those connections are very valuable. And lastly, I also want to talk about keeping in touch with them. When you find a mentor, trying to make sure to stay in touch with them, like maybe every 6 months or so. Say that during the previous meeting you had with them, they talk about, um, say, oh, reach out to this person. So then, like, couple weeks later, maybe just send them a text, an email, be like, hey, I reached out to this patient, not patient, I reached out to this person and we have been talking. We're gonna have a meeting on the next blah 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 week or so. The reason why you want to follow up with them because you want to show them that whenever they give you advices, you listen and you follow through. And mentor, the reason why they mentor students is because they want to see student success succeed, right? So when you give them or follow up and close the loop like that, it really, really help um, them to know that their advices do help students get into places. And so definitely close the loop, communicate with them, and then once in a while, if you like make any progress or accomplish something, feel free to send them a text as well. They want to hear how great you're doing, how you're progressing. And then at the very least, if you don't have any updates, at the very least, like keep in touch with them every 6 months or so. Okay. And then third thing is comparison. Comparison steals joy. Do not compare yourself to everybody around you. Everyone is on a different timeline. When I graduated TCU, which is my undergrad, I felt behind. I decided to take a gap year. I did a master program for 1 year. So at that time, I felt behind because everybody around me, they already know where they're going. They go into graduate school, they go into med school, they doing some research or something related. And I didn't figure out the master program until much later, maybe a couple weeks later after I graduated. So the moment during graduation, I remember vividly how defeated I felt because everybody already know what their plan is going to be, but I don't. And until like I was able to like get into a program and then get into med school subsequently after that. But it's you're on your own timeline, and now that I'm in residency, I then realized that I'm one of the youngest resident in my program. It is getting more challenging to get into med school, to get into residency. This field is difficult, but it does not mean that it's not doable. If this is what you think is for you and you have a passion for it, by all means, go for it. And whatever it take, if you have to take a detour, if you have to take a year or two, that is totally fine. Everybody's on their own timeline. I have a friend or a colleague who finished their PhD and come back and do med school, and now he's a resident with me. I have a another colleague who did engineering or some computer science, and then they came back, did med school, and now they're also like a surgeon with me or a surgery resident with me. So that to say that whatever your path that you're on, everybody's on a different timeline, everybody's on different path. So don't feel pressure by the other people around you. Just focus on yourself, focus on your goals and your dreams, and just move towards whatever you have determined to do. And if it takes, an extra step, if it takes a detour, let it be. Don't feel stressed about it. Fourth thing is never stop being curious. I think the medical students that are rotating with us, the best students that I've worked with are those who are very curious. They ask why, like, why are you doing this? Why your treatment plan is A and not B? Why do you want to get a CT scan and on ultrasound first? I think being curious is really make you a better student, a better physician, and a surgeon in the future because it allow you to sometimes think outside of the box as well. Because when you in residency, you will realize that not every patient is straightforward like the one in the textbook. They don't just have one problem. They don't just have diabetes. They don't just have abdominal pain. They don't just have appendicitis. They have so many things going on with them. And when you're treating them, you have to also be aware of the whole body working as a whole. They might have chronic kidney failure or chronic kidney disease that you have to also take into consideration, or heart disease. And if you want to take them to surgery, you want to make sure that their heart can take the anesthesia, right? So not every patient is the same. Not every cases will be the same. So being curious for you guys as pre-med, when you study all these physiology, think about the big picture. Why does it matter? Right? Ask the right questions. Go to office hours if you don't understand something and ask your professor, and most of the time they will be able to answer the question that you have, but never stop being curious. And then the last part is don't let medicine become your entire identity. And we talked about that. Have hobbies, stay in touch with your loved one, call them, and have a life outside of medicine. This medicine, being a doctor, being a physician, being a surgeon, it is an incredible career. Is it hard? Is it challenging? I would tell you that it is. I would be lying to you if I tell you that it's easy. It is not easy, but it's a very fulfilling and rewarding career. If I have to do it again, I will do it again. But it doesn't change the fact that it's difficult, and that's why I have other things around my life that I keep up with so that I don't feel like medicine consumed my entire life, right? You want your career to be a part of your life, and you want other aspect of your life so that you can feel fulfilled and not feeling like medicine is really consuming everything. All right. So I before I leave you for today, I would like to ask you to do something. I want everyone to think about of one person who inspired you to pursue medicine. And if you can, put in the chat, and let me know who have inspired you to be in medicine. I see a lot of parents. That's good. Okay. So now ask yourself, why did you choose that person? So I saw they meant a lot to me and sparked my interest in biology and chemistry. Love that somebody say, I want to help them. Mm, love it. Okay. So a lot of you guys putting down your reason of why the person who inspired you in medicine is because they have make a great impact in your life. That's what I'm seeing. So it's not really because they have the highest board score. It's not because they published the most paper. It's not because they were technically, the best doctor or the best surgeon, right? You remember them because of how they make you feel and how they listen to you and how they have shown you the way. And I think that is what today talk has been about. And that's the one takeaway that I want you guys to see is that the making of a doctor, it happens far beyond the operating room. Things that inspire you to become a doctor today, it might be something that will inspire the younger generation, the one who will follow you in the future to become a doctor or a physician. So if there's one thing that you can take away from today, let it be this. Medicine isn't just about becoming a doctor, it's about becoming the kind of person that patient can trust. And your knowledge will grow, your technical skill will improve, but your integrity, humility, resilience, and compassion are really what people will remember long after they leave the hospital. So don't spend the next few years focused on only building the perfect resume or getting into medical school. Spend them becoming the kind of person who inspire you to pursue medicine in the first place, right? And because in the end, that is really the making of a surgeon or a doctor. So that would be the wrap for my presentation today. We will be, let's see. I can take any question that you guys have in the next 30 minutes or so.
Yeah, so if people want to raise their hand if they have questions for Dr. Izzy, and then myself and Ayan will monitor the chat for any chat questions that maybe haven't been answered, and we'll let you know if there's anything interesting in the chat. Do you want to pick just like who you see first with their hand up on your screen, or do you want me to pick for you?
Um, See, I don't know how to pick. Can you just help me pick
Yeah.
some?
Okay. Yeah. Perfect. I'll just go in order then, and I'll just
Okay.
say names, and they'll unmute themselves. So
Okay.
first on my screen is Jonica.
Hi, thank you for your presentation. I just had a question on
Mhm.
what age do you recommend getting a mentor or like a person that can help you with like guiding you?
Mhm. I think you can get a mentor at any stage of your career. So let me ask you, what year are you or where along the medical path you're in right now?
I'm going to my sophomore year of high school.
Okay. So as a high school student, do you have any physicians around you or do you know of any?
There's like a clinic beside my house, but it's mostly, other than that, it's like professors at my school.
Okay. You can start with like professor in your school and see who they know, right? Reach out that way. Start locally since like you're start locally with your school first and see who your professor or high school teacher would know. And you want to be specific when you find these mentor. What are you hoping to accomplish or to get from the mentorship that you're looking for?
Okay, thank you so much.
Okay.
Next is Nithyasri. I'm very sorry if I mispronounce anyone's names.
Oh no, it's fine. Thank you for your presentation first of all. I myself am like hoping I become a surgeon in the foreseeable future. But I found myself wondering, due to mental health problems, like what is the most emotionally draining part of your job that everyone else doesn't get to see? Because it's like a super important aspect of your life, right?
Yes.
So, and how did you manage any problems that came with it?
Yeah, that's a very good question. I think the most mentally taxing thing that we have to do as doctors in general is being our best self to our patients. So, in one room, when you walk into one room with one patient, you might be delivering the worst news ever, right? And you have to compartmentalize your emotions because you want to be there for your patients. You want to give them the most objective information for them to make an informed decision for either their loved one or the patient themselves. And then after you walk out of that room, you might walk into the other room where you might tell them that, hey, like surgery went well and everything worked out perfectly. You'll be discharged to home today. So you don't really have a lot of time to recover from whatever emotions that you have from one interaction with the patient from the other. Um, and how would I tackle it? That's a good question. I think I have been doing this for quite a long time where I feel like when I walk out of a certain room, um, I sometimes if it feel emotionally taxing, I would give myself that 1 minute or two to just take a deep breath and decompress. And if I have the ability to go somewhere and maybe grab a drink or, do something in between before I see the next patient, I would do that. But sometime when you're in the ICU, when patient is crashing left and right, you might not have that time to emotionally digest. I think over the years, we just learn how to quickly recover from it. And then at the end of the day, I would debrief with myself and allow myself to think, reflect on the day and what happened. And if I need to talk to somebody, I talk to my fiance a lot. I talk to my colleague. I really heavily depending on my mentor, like I say, I have a mentor where I bounce cases idea from. Um, I think just having people around you and when you feel like something that is bothering you, come and talk to them. And most of the time, they're in the situation, they are in the same situation or they might have been in the same situation that you as you are now. They will be able to give you some advices. And it really did help me recover by just talking to people.
Thank you.
Mhm.
Next up is Emma.
Hi, thank you. I wanted to ask, is there anything you've had to really like give up or let go during your journey as
Mm,
in medicine?
yeah,
Uh,
I think I don't using the word I don't think I give up anything, but what I did do is delaying a certain aspect of my life. Um, I think throughout most of my 20, I did focus a lot on studying, on getting to med school. Um, I didn't know how to, manage my time better so I can have both my personal life on top of my academic life or career. I'm better at it now than I was before, but before when I was focusing on just like studying and stress about an exam, I would not hang out with anybody. I would not talk to anyone. I just like lock myself in the room and like study and get the things done until it's over. I will not like enjoy other aspect of my life. And that's why this presentation, when I try to come up with an idea of what I really want to tell you guys, is that you can have both. And I had a mentor back in med school who told me that there's three things in life that you choose every day. Either you hang out, social, or you sleep, or you study. So sleep, study, or social life. So there's three overall general thing, but you don't have to choose all of them because you can't really choose all of them in one day, but you can choose one or two things to prioritize that day. And then the next day you can choose another two things to prioritize the other day, on the next day. And overall, when you look at the whole week, you will see that, oh yeah, I accomplished something here, something there. Say that today you just want to study, that's fine, and sleep, then choose study and sleep. But tomorrow, maybe choose socializing and sleep and not study. Does it make sense? So I feel like learn how I don't think I gave up any part of my life, but I did think that I have delayed a certain aspect of my life, and that's why I'm trying to be more proactive in gaining that aspect of my life back, if that makes sense.
Thank you.
Mhm.
Next up is Alexander.
Yep, I think you really had a wonderful presentation. For my question, I would just like to wonder what were some like common difficulties that patients had like throughout your career, which they would require surgery. So what do you think was like the most common issue that patients had?
Mm, that would require them to get surgery.
Yeah, or
Yeah.
maybe like what's like the most common type of surgery you did as well.
Mm. We do, I mean, most common around here, we do a lot of gallbladder for general surgery. We do a lot of gallbladder surgery. We do a lot of appendectomy, which is removal of the appendix surgery. Um, we have a lot of emergency where we currently we're at a trauma one level center. So we have a lot of gunshot wounds and a lot of like car crash or motorbike crash since it's the summer now. So we do get a lot of those cases. And when they do need an emergency surgery, if their bowel is injured, we have to go in there and remove it. Or if like the vessel is injured from the gunshot wound, then we have to repair it. So it's really we have a lot of trauma here, but I think the most common general surgery would I would say gallbladder and appendix.
Right, thank you. Because I know it's gonna be very difficult sometimes and also very uncomfortable to deal with those situations. So
Uh-huh.
thank you. 'Cause I know it's not something easy to go through.
Yeah.
All right. Next up is Sonam.
Hi, I really loved your presentation, and I was wondering, like, what is something about like surgical residency that turned out to be different from like what you expected?
hmm let's see. Turn out to be different. I think I didn't expect my first 2 years to be non-operative, mostly non-operative. I think, and it's really tied back to the whole idea of the presentation that like becoming a good doctor is learning how to be a good doctor outside of either the OR or the hospital. Most of my first 2 year is spent learning how the hospital function, how to get patients into the OR, how to know when they're ready to go home, and figuring out which patients really need surgery. I think that is something that I I think it was a surprise to me because I was expecting to do a lot more surgery like during my first 2 years of residency, but I think that it's really important to learn everything outside of surgery as well, because now that we are moving up to fourth and fifth year, we'll be heavily operating. But once you get out of the OR, patients might be crashing on you. There might be something wrong with them that you might have to make a decision quickly, or else like some bad outcome will happen. And really, the first 2 and 3 years prepare me for it. So when I come to into the OR and focus on like building my technical skill, I know how to handle the floor when I come out.
Thank you.
Mhm.
Next up is Elizabeth.
You said that you had a lot of, or not a lot, but there are bad outcomes in the medical field. How
Mhm.
would you deal with that?
Yeah. Um, I think talking to colleagues, like I mentioned previously, really helped. Because sometimes my fiance is in medical field, but he's not in a surgical field. So when there's a surgical bad outcome, it helps me when I talk to my colleagues because they will be objective about it. They would tell me that this can be better or that can be better, or sometimes they might tell me that, oh, that's the best thing you can do for that patient at the time. Because when you operate on the patients, not everybody is the same. Like I mentioned, they might have had multiple surgery in their abdomen before, and when they had multiple surgery before, their abdomen will scar down, like how you would get a scar on your skin, and the subsequent surgery will be more and more difficult because when everything is just scarred down, you can't really get into the right place to get to the right problem, to get to the issue and fix it. And so I think when there is a bad complication or the outcome of, or an unwanted outcome, I would say is a better term for it, I usually talk to my colleague and we debrief and we go through the steps of surgery and what went wrong, if there was something that went wrong, what could have been improved, and what would be the learning takeaway for that day.
Cool. Next up is Kelly.
Hi, nice to meet you. It was a really insightful presentation. So
earlier I heard you mention you were like a trauma surgeon, and
Mhm.
I'm wondering, as a trauma surgeon, how do you think it differs from other surgeries in terms of like the sets of skills involved and how you interact and build relationships with teams and patients?
Yeah. So I'm currently on a trauma surgery rotation right now. I'm a general surgery resident. But so trauma surgeon, they are essentially required to think on the flight. Patient come in, they are crashing very quickly, and you have very limited amount of information. Not like the abdominal pain patient that we talked about, like in the beginning of my presentation, where we have time to like ask them about history, you know, taking them for like imaging if needed, and figuring out what the problem actually is. When a trauma patient came in, all we know is they were in a car crash at 60 mile per hour, and they've been in the car for however long. And if there isn't a physical injury where we see deformity on their body, we wouldn't know. We would have no clue what is like injured inside, right? So trauma surgeon, they're special in a way where they are able to put together all of the clinical information that are presented in front of them at the time and make a decision. I think not a lot of other specialty would required to do that, because sometimes we have at least adequate amount of information before we make a decision, but for trauma surgeon they don't. And you will find things as you go. You know this patient is crashing, you don't know why they're crashing, so when you go into the belly, you might find that their aorta is injured, you might find their, iliac or their big vessel are injured, or their kidney, their liver, their spleen, like you find things as you go, and then they have to make a decision quickly to like damage control as soon as possible, because every second count in a trauma situation.
Yeah, thank you so much.
Mhm.
Next is Divya.
Hi, I also really enjoyed your presentation. I liked how it wasn't focused on the technical aspects, but more like the how you prosper in this pathway. So my question is, since you mentioned that no one saves lives alone,
Mhm.
what team members' roles do you think is really underestimated in surgery? You would like to give more credit to?
Yeah, that's a really good question. I think the scrub tech is hands down one of the most important um, person or team member in an operation, let alone other like situation, because they know how to they already anticipate the next step. If they work with a certain surgeon for a long time, they know exactly their next move, and you just put your hand out and they already know what to give you. And I think it really helps the surgery go smoothly. And they have everything ready. Like if there's a certain case, they know it's a specific surgeon and they know what tool they would want. They already have that ready on the table. Because if you have somebody who is not familiar with the case, as we ask for things, you will see people running around looking for things, and they have to go down to the basement to look for more tool. It really delay the next step, and patient is being put under anesthesia, right? And some of them, they might be sick. Their heart might not be able to take the anesthetic medication for a long time. So every minute counts. Having a really good scrub tech in the room really does make a difference in terms of surgery. Now, in trauma situation, I think that in that specific situation, the team leader, which is usually the trauma chief or like the surgery chief, but I think the surgery chief is the one who essentially orchestrating everything. He or she is the one standing in front of the patient, but also observing the whole entire room and making sure everybody has a role, and making sure that certain task is being done for the patient who is crashing in front of us. But in terms of who is more important than the other, I don't think anybody would be in terms of like a trauma situation. I think we all will have like a really big role. Like there's an ultrasound person who is like making sure that there's no blood in the abdomen or in the heart that we need to act on. There's like nurses who are putting IVs so that we can like put in medication, put in like blood. There's like another nurse like documenting everything. And there's a pharmacist who grabbing medication for us. And there's somebody who's running to grab blood. It's a very hectic situation. And in that case, everybody play a role in saving the person who is in front of us.
Thank you.
Mhm.
Next is on.
Hi, Doctor. Thank you for your presentation. I
Mhm.
just wanted to ask, what city in Vietnam are you from, and what was the hardest part about moving from Vietnam to the United States?
Yeah, I was from Long Thanh, which is near Ho Chi Minh City. I think it's about like 45 minutes by car. The hardest part about moving is really learning the language itself. During my first year in the United States, I could not understand anything anybody was telling me besides math, because math is universal. I can solve a problem without like needing to understand the instruction as much. But when it comes to reading, when it comes to everything else, I have no clue. Like, and then they had me take a they call us a star test. Back in the day, I was living in Texas, so like every year, and at the end of the year, they would have us take the star test. And I remember vividly using a dictionary, like a paper dictionary, flipping every pages, looking for every word of translation of the instruction of the questions. Like I could not understand anything. It was very frustrating. It was frustrating for a whole entire year. But that frustration really helped me to focus on learning the language, because I know that that's the first step to even like be able to function in a new societies is like able to communicate. So that's when I, um, you know, we have a little electronic dictionary too that we used back in the day, so it helps improve the efficiency. So I would be translating every word. I would learn new words every day. I would try to listen to the conversation everybody have around me and try to pick up like sentence structure. And then within our group of friends who literally just migrated over or just moved over from another country or from Vietnam for like a year, so we don't know much English either. But I told them that like when we talk to each other, we will speak strictly English. Even if we struggle, we will struggle together. And I think that really helped us improve a year later. And I pick up English more along the way. But it after that whole intense year of just like really focus and trying to figure out how I can improve myself. That helped my English improve significantly, and that how I was able to transfer to my homeschool, because I was at a special school where they focus more on like teaching us the language than like teaching us the knowledge for like eighth grader at the time.
Thank you.
Mhm.
Next is Rachel.
Hi, so as a high school student, I think the hardest part is staying consistent with all these like study habits or systems,
Mhm.
especially as you had mentioned that it's important not to rely on motivation, but rather build like a personalized system that works for you.
Mhm.
And so, I think a lot of people are prone to exhaustion or kind of being discouraged even through these systems. So how would you recommend any like bare minimum habits that you would keep rely on even during these kind of situations?
Mhm. I think first step is figuring out what kind of learner you are, right? There's auditory learner, visual learner, and I think there's tactile learner. There's different way of learning things. For me, I'm a visual learner, so if I don't see something, I will forget it. And or like if I don't see things being written in a certain way, picture helps a lot with or concept mapping. Um, so that's what I figure would work for me. So on the day that I feel like it's a difficult day, I don't have much time to accomplish things, then I would just jot down like, what I've learned for the day. For example, for me in surgery, I jot down the cases, like what kind of position, what step that I missed during that case, or like what special thing about that specific attending, that specific case that I want to remember for the next time I'm in the same OR room with them, or like positioning. I just quickly write it down. It's literally just plain text because I don't have, the time to make it pretty or whatever. It's just on my notepad. So try to find a way that like you say, on the worst day where you feel like you don't have time, you're tired, you can still just put down something quickly. Um, in terms of you guys in high school, um, I feel like if there is a certain concept. I know my brother, he watched a lot of videos, just like listening to people talking to them, to him is his way of learning. So if that day you feel like you're tired already, you don't want to read another slide, another textbook, another page, maybe watch somebody talk to you about that concept. It might just be 2 minutes and you might learn something from the things that you struggling with or the topic that you're struggling with for that day, right? I listen to podcasts too. On my drive to work or from work, if I don't have time to study, that's literally might be the only time that I study that day is listening to a podcast. We have a podcast called Behind the Knife, and it's really helpful because it sometimes they review journal, new paper that being published, new guideline, new standard of doing surgery. So and I can just listen to them quickly on my way to work. And so that is an example, figuring out what small little things you can do, like you can hear, you can watch when you don't have the um, brain power or bandwidth to tackle a little more. Does that make sense?
Yeah, thank you so much.
Mhm.
On that topic, a quick question from the chat that people have thumbs up is how do you navigate lack of sleep while you have to be in the operating room? Now,
Yeah.
I know when you're a general surgeon, a lot of those surgeries are in the morning on purpose,
Hmm.
so that you have the time to, have your fresh brain.
Yeah.
And obviously, a lot of surgeons drink a lot of coffee. But now you're under trauma surgery rotation, and you don't really have that option of, scheduling surgeries. So I think this is a pretty good question.
Yes, it is a very good question. And to be honest, I sleep whenever and wherever I can. If my body is exhausted, even if I have a certain task for that day, I go to sleep. Your body know when it's at its limit. And even though I work long hour, sometimes it's literally just me going home, eat, and then go to sleep. I didn't have time to do anything else. And that is okay if you have a day like that where all you can do is to go to sleep so you can regain your focus, regain your energy so you can tackle the next day better, then please go to sleep. Like, I think that's the most important thing that I never give up. I remember one of the student has asked me earlier if I give up anything. I think sleep was one of the things that I never let go of. Even in med school, where I need to study long hour, I don't pull all-nighter. I sleep before I test, before a big exam. You want your brain to be fresh, and if you don't have a fresh brain, you everything that you have planned to do, you're just gonna be very inefficient. Like things that might take you an hour to accomplish if you are fresh and you slept well, might take you 2 or 3 hours. So you might be sitting there feeling like you've spent 9 hours of studying or 4 hours of studying, but it's not productive because none of the information you have trying to absorb throughout that 4 or 5 or 9 hours, none of that is going into your brain. So be efficient by preparing and giving your body what it needs. Don't skip meal, don't skip sleep, and give yourself the basic needs that it needs before you tackle everything else. And that's what I did. Even if like I don't have time to do everything else, the first thing I would want to do is to go to sleep whenever I can.
Awesome. Thank you. Yuna, you are next.
Hey, so I'm currently working towards like med field currently,
Mhm.
but I'm not really 100% sure about it, I think. So I
Yeah.
was wondering if you had that like one specific moment where you thought, oh, I want to become a surgeon, or was it like a gradual, slow like process?
It's a gradual, slow process for me. In the beginning, I know I want to help people, and it's actually very vague, because you can help other in other special like other career as well, right? But I know I want to use science. I was really enjoying learning biology, chemistry specifically. So all the STEM classes, I really enjoy them. So when I decided that medicine is for me, I know that I want to help people and I want to use science. And that's how I come up with the idea that I probably gonna want to be in medicine. Now, in college, I wasn't 100% sure if I want to be a doctor, a pharmacist, or other aspect in healthcare. So what I did was I actually go shadow and I did work as a certified tech farm tech for about 3 or 4 months, and that's how I figure out that I don't want to be a pharmacist. I thought about dental school as well, but you just kind of like have to explore all this possibility. If there is anything, any reason in your brain that I want to try this career out, go shadow somebody. I think that's the best way for you to figure it out is see what that person do during their everyday doing that job, so you have an understanding of it. Because being a doc or being a surgeon, not every day looks like Grey's Anatomy, where everything is hectic. Like there's something crazy going on. My day yesterday is literally not, I didn't have any cases in the OR. We just saw patients on the floor. We make plans for them. We talk to the social worker and making sure that they have a plan to go home with, making sure that the pharmacy is open so that when I discharge them, they will be able to pick up their pain meds because you don't want to discharge them at 7 p.m. and they just had a big surgery done yesterday and now they're in a lot of pain and they can't pick up their medications, right? So a lot of that you have to think about as a doctor as well, and not just like learning to like operate. Um, and so I think back to the whole entire idea is just and then so then when I figure out that I want to be in medicine specifically, I shadow I think an ED doctor at the time, and I saw a trauma at that time, and that was when I finally decided like yes, I want to be a doctor. I want to be participating in making that decision, using all of the data in front of me, all the clinical information that I have, and make a judgment and make a decision and help patients. So I think what is the best for you to figure out which specialty or career or which branch of healthcare you want to go into is to go and shadow somebody.
Thank you.
Ogoma, you're next.
Hi, thank you for your presentation. I know that you mentioned that one of the hardest parts of residency is learning who you become under pressure. And I was just wondering if you have any advice on how to work better under pressure.
Yeah, over the years, I have learned to recognize when I am emotionally heightened. I think in the past, when I feel like I'm being overwhelmed by a certain emotion, because when you're under pressure, you start feeling a lot of emotion. You're stressed. You start thinking like, oh my gosh, like I don't know enough. You start going down the rabbit hole very quickly. And then I saw that my performance suffer because because that same exact task, if I'm not under pressure, I will do 100% much better. But when I'm under pressure, like you have something called cognition overload, where your brain is just completely shut down and all it focuses on is all the negativity and about, oh my gosh, like what is the next criticism my attending or my chief going to give to me, and then you start going down the rabbit hole and then like you start not focusing on the task in front of you. So over the year what I learned is whenever to recognize it. I think the first step is you have to learn how you learn to recognize when you start getting to that point. When you start feeling like you're stressed, you are freaking out, you are starting to go down to the rabbit hole, then assure yourself and say that, hey, stay calm, because if you stay calm, you will do better. And every single time that I told myself that, I stay calm, I remain calm, and I do 100% better. Doesn't mean that like I'm not shaking. Let me tell you, the pressure is still there. But as you expose yourself to that moment over and over the year, you start to become unfazed by almost anything, right? If you confront similar situation, now you will have new experience, new situation where you're being put under new pressure. But you just have to tell yourself, stay calm, because if you don't, your performance will suffer. You will do worse than you would if you're not staying calm. And that's how, over the years, I learned to be better at like regulating my emotion and remain calm and getting the task done.
Thank you so much.
Mhm.
Manuel? Manuel, you're still muted if you're talking.
Sorry, you cut out when you said my name, so I wasn't sure if it was
Oh,
me.
no, yeah,
Um,
it's you.
okay. Thank you so much for your presentation, Doctor. I was just wondering, like, what person inspired you to become a doctor, and like, what are their qualities like helped you succeed in that?
Yeah. So back in pre-med, I followed that emergency medicine doctor, and I was in a trauma situation. And um, also, there was a case where I remember vividly where he told me that when the patient had put their fist onto their chest like this, when you ask them where their chest pain is, it means that they're gonna have a heart attack. Like a heart attack is coming. And literally 15 minutes later, overhead, they were calling out that like an MI alert or something like that. And I was just like, wow, like he could predict things from happening that is going to happen. And I thought I was very impressed. I was very intrigued by it. I was like, wow, like I can use a lot of sciences and a lot of knowledge to be able to help this patient here and figure that or anticipating things and be proactive at it. Because once we figure out that this patient might be about to go into a heart attack, like we mobilize, like, the team, we mobilize the resources and be ready for it. I think that was one of the moments where I decided that medicine is for me, or being a doctor is for me. Now, becoming a surgeon was not something that I know throughout my whole entire career. When I got into medical school, initially I thought I wanted to become a pediatrician actually, because I have a lot of siblings. I grew up taking care of them, and I do have like a fond relationship with like the kids. And then I remember it was during cadaver lab where we are being asked to dissect out a certain structure, and as a person who is very OCD, I like to see things, like I like to cut things very neatly, and I like to see my structure. I don't want to go through things and not being able to identify the structure that I need to see for my exam. Like at that time, my goal is to be able to find the right structure, know what it looks like, so that on the exam day, I know what I'm looking at and get the right answer. That was my ultimate goal during the cadaver lab. But then my professor saw how like meticulous I was with like the dissection, and my anatomy professor, and he came up to me and he was like, "Have you ever thought of like becoming a surgeon?" I was like, "No." I was literally told him like, "No, not like I have never thought of becoming a surgeon. Like not even that idea has never crossed my mind." Um, but then like over the months of like cadaver lab, I think like he kind of dropped a seed in my brain. I was just like, maybe I should consider it. To be honest with you, that was when I started to consider and not really like 100% going into it already, wanting to go into it. But yeah, throughout the months in the cadaver lab, I started noticing more that I do enjoy to like dissect. I do enjoy to like being meticulous, using my hand, doing procedure. And then during third year, when I go and rotate through surgery, that was when I finally decided, like, okay, I would go into surgery. But I did not know that um, when I first started thinking about going to medicine.
Thank you so much.
Mhm.
Next is Lucas.
Hi, thank you so much for presenting. I thought it was really inspirational. Um, I just wanted to ask, was there ever a moment in like university or med school where you seriously questioned whether medicine was still the right path for you? And so like kind of what happened there?
Yeah, I do. Like I say, it's difficult. I would be lying to you if I don't question myself. And those days are the hard days are those days where my family have like a wedding, my cousin have a birthday, or like my other cousin just gave birth to her son, and I was not there for any of it. And my family, while my family is very understanding that my training takes quite some time, and I try to be proactive in like FaceTiming them, calling them, staying connected, but it doesn't really, alleviate the guilt that I have that like I could have been there for my family, right? Um, and so those are the hard days where I questions like, is it even worth it? Like, I'm going into this path for now. It's been like what, 11 years now. So it's long and it's going to be another like 3 years. And with fellowship, it might be another 3 years. So I'm looking at like 6 year in total. So there's definitely days where I feel like this is difficult, this is challenging, and I'm away from home too. But I think ultimately, like I was telling you guys in the beginning, is that like I really figure that I want to do surgery out of solely passion. And there are so many people when I was in med school gave told me, or my colleagues at the time was telling me how like surgery wouldn't be a great fit for lifestyle in general, and how like being a woman, I want a family, and all of that, it would be challenging. And even my parents, my mom wasn't very fond of the idea of me going to surgery in such a long training. So I have a lot of people who told me I shouldn't do it. But at the end of the day, I decided to do it because I really want to, like I mentioned, use my hands. I want to do procedure. I do think that we make the greatest impact to patients. Like, for example, trauma surgery, when patient came in, they crashing, but like we did everything we could. And, the next week we saw them getting better. And next 2, 3, 4 weeks, they got out of the hospital. We even hold like trauma conference. Like I think every year we bring back some patient who had sustained or who was in a trauma, and they came back and they were being so grateful for us. I think those moments, the moment that you're really like training because ultimately somebody's lives will be in your hand one day, it's really kept me going. Because I ask myself, if a patient is crashing in front of me, do I know how to take care of them and bring them to recovery? And the question is no, like I don't completely know every single step to take them there. And that's why I need this training. That's why I need my attending around me, my colleagues, so that whenever I need help, there is somebody who is always available to help me out. And my goal is to help, patients who like in the worst day of their lives, like I mentioned in my presentation. And to be able to get there, to do that, you need to be responsible for it. You want to make sure you have the knowledge to do so. So yes, training sucks. Yes, residency is long, but if it's what it takes for me to get there and to do the thing that I want to do, I'll do it. And but not at the cost of my other aspect of life, right? So that's why I'm also trying to be proactive in trying to gain some aspect of my life back, so that I don't feel like this path has been just me doing surgery and medicine for 10, 15 years and, letting go of everything else around me.
Thank you for sharing.
Hmm.
Next is Shui.
Yep.
First of all, thank you so much for your presentation. It was very insightful. I wanted to ask, like, since you're making such major decisions in like such a short amount of time in the trauma ward, like you
Mhm.
said, it can be like very stressful and very high pressure. And
Yeah.
since you mentioned that it's like a very team-based specialty, are there ever any times where there are like conflicts or disagreements within the team regarding like what procedures the patient should undergo, and like how do you navigate through that?
Um, I wouldn't say there is conflict. I would say that we would bring up our observation and what's called judgment, right? So, and that's why we try to create an environment where people feel comfortable of speaking up no matter what specialty of healthcare they are in, right? For example, the other day, I had a med student who was in the OR and he actually broke the sterile field, and I noticed it while nobody didn't notice it, and no one in the surgery noticed it. So I actually asked him, I was like, hey, did you touch this thing? You know, like it was not sterile. So did you touch this thing? But then I have to preface as it's okay if you did. I just want to know. So if you need to, you need to change your glove and that it will be okay. And that was when he admitted to me that he did break sterofield. And that's okay. I asked the scrub tech, hey, can we get a new pair of glove? We're gonna switch it out. It'll be okay. But I also told him that next time if you break sterofield, just let us know. We just want to make sure that, it's for the safety of the patient. I don't want any infection, we want the best for of our patient. And he was like, okay, I understand. I think that is really important in any field of medicine is that when you see something, you bring it up, even if you're going to be a medical student, even if you're going to be a pre-med, just say, hey, like, I noticed it, and raise your concern, because it's not really a conflict. It's a team sport. If you notice something, the other person have, might not be aware of it. And the same thing with my chief too. Whenever I notice something, I bring it up to him. I would tell him that like, hey, this is the reason why I have this conclusion or I make this judgment, and this is the next step I think we should take. And he would be very fond to it because you have a reason. You're not trying to sabotage anybody or saying that they're wrong. Again, medicine, there is no right or wrong answer. We are just there to make the best decision for the patient in front of us at that time. So we don't generally have conflict. We just might have different idea, and that's how you want to hear everybody out, especially if you're in a leadership position, like in a trauma bay, and you are the person who orchestrating everything. You want to make sure you listen to everyone who what and about what they have to say, right? So I hope that answered your question. And I hope that even if you go shadow and you see some conflicts and you see, this disagreement in the medical field or among the medical or team member, I hope that at least what you can take from me is that to be a proper leader, to act at the best interest for your patient, you want to hear everybody out, and you want to give a reason when you have a different opinion, right? You don't just want to be you don't want to just make an objective statement. You want to have a reason to back it up, and you want to be that person who is grounded and who is not being affected by um, people giving you feedback, if that makes sense.
Right. Thank you so much.
Mhm.
It is 10:30, so out of respect for your time, Dr. Izzy, if
Mhm.
you have time for like one or two more, that's great. If you have to go, that's okay. But just before you do, I see your Instagram is on your last slide. Is that your preferred method for people to reach out to you, to contact you?
Um,
Or is there a different one that's better?
I do have an email that's also attached to the Instagram as well. I can leave it here.
Okay,
It
perfect.
all goes to the same place.
Okay, so if participants have questions, if they want to follow Dr. Izzy's journey, for surgical training stuff, for life in medicine, follow her Instagram and definitely and email her if you have something you want to talk to her about. Do you have time for like one or two more? Is that okay?
Yeah, I don't have anything today. If you want to go through all the questions everybody have, I'm more than happy to do so as well.
Okay, so we have another session soon, but we can take a few more questions just until we have to move on. We have a
Okay.
little bit of time. Okay, perfect. So we'll do like three or four more. If you have a good question, you want to ask Dr. Izzy something, you can contact her on these methods. So next is Young. Okay, if not Young, then the next is Matthew.
Oh, sorry, I couldn't hear you because it cut off halfway. I'm
Oh,
so
okay,
sorry
so
about
Young
that.
is next.
Oh, thank you so much for your time today. Can you describe a patient interaction that permanently changed the way you treated patients or practiced medicine?
Mm-hmm. Um, I think one interaction, yeah. So this patients who came in and they just have surgery, really big surgery yesterday, and they're trauma patients. They have a lot of broken bones everywhere, and they have to go into surgery to fix all these bones, their arm, their legs, in a lot of pain. But they also have a history of drug-seeking behavior. Um, so when you are a clinician, and you come across a situation like this, even if they have a drug-seeking behavior in their past medical history, it shouldn't change the way that we treat the patients in front of us, who is just literally went through a trauma and went through a big surgery. And if anything, because they have used, other opioid medications before and are dependent on it, their tolerance is much, much higher comparing to us who like don't use, or comparing to other patients who don't use like as many pain meds outside, or they might have like chronic pain, back pain that is on chronic pain medications, and so those patients they have a very high threshold. So I think when I first treat this patient, I didn't know that they have very high threshold for pain medications. Like you would be giving them a lot of pain med, but it would not touch their pain. Right. And it's easy for you to start having other aspect around this patient to influence your judgment or your decision. But ultimately, I had my attending who explained to me that, they would have high pain tolerance because they would be using pain meds chronically at home. So you want to give them more. And so we gave them like a pain regimen that would help their pain, and they have a legitimate reason why they're in so much pain. And I think that's just one thing that I learned um, after that patient interaction, is that I shouldn't let other aspect about the patient impair my clinical judgment and how I make decision in treating the patient in front of me.
Thank you so much.
Mhm.
Next is Matthew.
Hello. So you mentioned how like in the trauma ward, like things are very fast paced because like you need to like be able to give the patient proper treatment when they're crashing very quickly. So I was
Mhm.
wondering like how are you able to like handle such situations like that, and like what skills can you focus on to be able to manage it?
Yeah. So even in a trauma situation, it's very chaotic, but we do have a systematic approach to when a trauma patient come in. And I think this will help you guys see how when things go south, like having a system really, really helps to make sure you don't miss things. So when patient came in, we call it the ABC: airway, breathing, and circulation. Those are the three important things that we focus on when trauma patient come in. Airway, we need to make sure they're breathing. Are they like wheezing? Are they struggling to breathe? Are they unconscious? Can they protect their airway? That's our number one priority. If that checked out, then we worry about their breathing, right? So airway, we want to make sure that nothing is like obstructing, like if they're not having a fracture in their face that like is causing them to not be able to get that air back into their trachea. So that is the airway I'm talking about. And then breathing is like making sure their lungs expanding, right? Like if they're breathing and you can hear breath sounds in their lung. And then C is circulation, which is their vasculature. Are they bleeding out somewhere? If they're bleeding out from their leg, do we have a tourniquet up to stop that bleeding temporarily? So those three things, because we have a systematic approach to when trauma patients come in, it helps us go through step one, two, three when the patient is crashing and making decision based off of the information as we get from these initial step. And then there are more step afterwards as well to making sure that we checking for other injury that we need to act on immediately. So yeah, in the trauma ward, even though it's chaotic, having a system helps. And for you guys, early in your career, trying to figure out a system that works for you. So even when the day goes hectic, you still are able to accomplish something that you plan on to accomplishing that day.
Okay, thank you.
Mhm.
Okay, next is Donha.
Hello, Dr. Izzy. Thank you so much for your presentation.
Yeah.
So I want to ask, did you ever have a patient that you will probably remember for the rest of your career? Like, not because their case was like super rare or interesting, but
Mhm.
because it changed how you think about medicine.
Yeah, I do. This patient is a cancer patient. He just got diagnosed with cancer. And I've been seeing him in the hospital for a couple of days, and we were the one who who delivered the news. And then the following day, when I saw him bright early in the morning, it's like 6 a.m. The first thing he told me was like, "Wow, like you're here so early. I hope to get, to go home early today. I hope to get some rest. Thank you for being here. Thank you for like, checking in on me." And I don't know, it just touched me. It touched my heart in a way that the moment I walked out of that room, like I start like tearing up because when you're in that situation, when you're a patient, when you literally got a terminal cancer diagnosis, but still you're thinking about the people around you who are taking care of you, I think that take a lot out of the person. And that's something that I learned from him too. Like how he's able to handle such news and stay calm and still care about other people around him. That's something I should also learn from my patient. I should, no matter what impact me, no matter what feeling, what other emotional things going on, I should be clear-minded when it comes to like taking care of the other people around me because they don't know what's going on. That's good. That they don't know what's going on with you, but they deserve the best care, right? And I think I remember him. I still remember how he looks. I still remember his diagnoses. I will remember if he walked past me outside somewhere. But yeah, he really made the biggest impact in my life during my intern year.
Thank you so much.
Mhm.
Next is Ellie.
Hi, thank you so much. Um, I was kind of wondering, like, I know be like your journey, your process was a long time,
Uh-huh.
in like discovering that you want to be a surgeon. However, I was wondering, like, if you have any like future plans to like maybe pivot or like, do you really see yourself like doing trauma surgery or doing surgery for like basically the rest of your life?
Yeah, I'm currently interested in plastic surgery, so I do see myself going into a fellowship to pursue plastic surgery and reconstruction. But I do see myself doing surgery for the rest of my life, and um, I might have side quest. I might do other things. Like currently, I'm doing social media right now. I think the reason why I'm doing it is because I want to be able to share with students like you guys or like any individual who are aspiring to become doctor or surgeon in the future, but for some reason they are, hesitating, just like how I was, right? We all have been there. I've all been in your shoes where I have questions about my ability, whether or not I'm good enough. So I do have little side quests because I have a goal. I have, a objective to help inspire others like you guys to move forward with your dream no matter what it takes. But ultimately my main goal is still to be a surgeon, and because that's what I signed up for. I've been here doing this for like almost 10 plus years now, so it would be hard for me to not wanting to do surgery and to put in that much amount of work.
Okay, thank you so much.
Mhm.
Next up on my screen is Angelina.
Hi, first of all, thank you for sharing with us. And my question was that um a lot of your advice has been about like becoming the right person, like building
Mhm.
habits, finding mentor, and staying curious. And looking back, what do you think was the single biggest turning point in helping you become that person?
Um, what's the biggest turning point? I think when I stay curious, it helps with the studying. Um, Let me rephrase this. When I was in med school, I know studying is just very, like, sometimes it feels taxing. Sometimes it feels like you just memorizing things and you don't really know, like, and then memorizing things to take the test. But I think being curious allow you to ask why. Why am I learning this? Why am I studying all of these like physiology, all of these like anatomy or like biochemistry or whatever that you guys are learning? I think there's always a bigger picture that the curiosity will take you there. And being curious also helps connecting the dot as well. You want to be a critical thinker. You don't want to just memorize things for the sake of memorization. You want to know why, like, we discover this, like why the Krebs cycle is important. Everybody hates the Krebs cycle um, because there's so many molecules in there. It's such a tedious thing to remember. But the overall picture is not really memorizing the Krebs cycle, but like what is the purpose of that? Of the Krebs cycle is create energy, and energy is basically the foundation of life, right? And then as you go into medicine, you will like kind of start understanding why we have to break down and learn all these ATP and all these energy, because like nutrition is important. Like for surgery, we want to make sure that the patient is getting enough nutrition so they can heal from whatever wound that they're having after the surgery. So all of that ultimately will have actually a big picture, a bigger reason why we're learning these right now. And I think being curious allow you to ask that next questions, to stay grounded and to be invested in your studying and education and not being passive with your learning, if that makes sense.
Yeah, thank you.
Mhm.
Next up is Elizabeth.
Hi, thank you so much for your presentation. The question I had was, what was the most challenging part about transitioning from medical school to becoming a surgical resident?
Yeah. I think intern year was really difficult in a way that one, I moved away from home farther, away from home. I was here alone by myself, and then having to learn the hospital system. Here we work within 5 different hospital. So every month when I start feeling comfortable with a certain hospital system, I move to the next one. And then it just happened like that every single rotation for 12 months straight, where you feel like you get a hold of something and then you moved on, and then now you don't, like, you're starting from scratch. You don't know anything all over again. And it was a frustrating part of intern year. And I think that is also really the reason why I kept on telling you guys to go out there, do more than just study, be in a leadership position, volunteer, have a side quest, whatever that is. Like have a side quest and go and get it done because you want to be in that uncomfortable position. You want to push yourself outside of your limitation. You want to prepare yourself because if you want to go into medicine, you will be thrown with a lot of curveballs that you don't expect. And no matter how OCD you are, no matter how much of a planner you are, things will go south. And I'm a very big planner. I plan my life to the T, but even so, there are things that go off of my way, and I have to learn how to recover from it and be calm. Like remember I told you guys about being calm. It's really important because for you to not if you don't stay calm and you stay stressed, then it will affect your performance. So a lot of that is really learning to to focus and essentially um, you know stay grounded.
Okay, thank you.
Mhm.
Okay, I think we have time for two more last questions. So we're going to do Sahar and then we're going to do Daniel. And then a reminder to anyone who has questions and wants to contact Dr. Izzy that her contact information is on this last slide. So Sahar?
Hi, thank you for your presentation. And I was wondering, what do you think is something about surgery that can't be learned from a textbook?
I think the real something you can't learn from the textbook is the relationship that you build with your patient. Um, that is really important for you to talk, for us to talk to patients before the surgery and after surgery before they go home. There's some surgery that is elective, so they will come in and out on the same day. But having that really relationship with your patient is very important. Um, you want them to be on the same page with you, and that trust between the patients and the healthcare provider really improve the patient care because when they trust you, they will follow your recommendations and whatever the recommendations would be, it will help with their healing. Because sometimes you'll have patients that they won't follow through. So when you establish that relationship, it really you help them.
Okay, and then last not least for today is Daniel.
Hi. So I understand that AI has become like really relevant in the field of medicine over the years, and there are concerns that like AI can take over jobs in medicine. I'm
Yeah.
wondering if you think the same thing applies to surgery.
Um, I don't think AI will be able to completely replace um the surgery aspect itself. Because I do think that AI will help us be more effective and efficient as surgeons. So one way that I can think that AI can assist us is, for example, identifying a critical structure in the OR or in the surgery. So nowadays we do a lot of things robotic as well. So I can see one way that AI would be able to help us look at the certain structure and maybe alert us that this is a critical structure that we need to be careful around this area. Other aspect of AI that have already been incorporated into our day-to-day life is some like in medical chart. So nowadays we actually have a summary of the patient hospital course on the side of the chart that is being formulated by AI, and it's a really incredible tool because when I was in the ICU, when the patient has been there for weeks and months and they had a lot of critical moment, a lot of time where things go south, AI really helps summarize it and really focus on help the person who comes after me during that rotation will learn about the patient hospital course in a shorter amount of time. I do honestly think AI will help us be efficient, but to be completely replaced, I don't know. I can't speak for the future. Maybe that's where we're heading towards too, but I don't think it can replace the human interaction that I was talking about, how you want to build that interaction with your patients. I don't think AI can replace that aspect of medicine.
Thank you.
Mhm.
All right. If everyone could do a virtual round of applause for Dr. Izzy, and thank you so much for joining us today. We'll take a few minute break, like maybe 2, 3 minute break, and then Davina is going to run a very relevant workshop, especially considering what Dr. Izzy talked about reaching out to mentors, research, and cold emailing, and all about that kind of stuff. So we'll be back in a few minutes. Thank you so much, Dr. Izzy, for joining us today. And I can tell the students loved it. So thank you so much.
You're welcome. Thank you. It was my greatest honor to be here. You guys take care. Have fun.
So if anyone needs to go to the bathroom, get a glass of water or anything, now's the time. In like 2, 3 minutes, Davina will start up with the workshop for today.
Okay, hi everyone. We'll go ahead and get started with the cold emailing and neuroscience research workshop. The neuroscience part of it is pretty short because we have a medical student coming in next week who's going to be teaching you about the anatomy and physiology of the nervous system, which is very exciting. But I really love teaching this kind of introduction to neuroscience research workshop because I really love neuroscience. And I know that for a lot of you, you probably haven't experienced anything to do with neuroscience that much, especially since not a lot of high school classes really focus on it, and it's mostly just college majors. So I'm hoping that for some of you, this will be your first time hearing about it and you might find it interesting. But even if you don't want to go on and become a neuroscience major, my hope for you is just that you learn something. And then I'm also very excited to do the cold emailing workshop. This is something that we started doing in the winter, and I think it's really important. Um, in helping you kind of develop professional skills and work on networking. So I will go ahead and share my screen, but all of these resources have been made available in our Google Drive. Our Google Drive is always updated with all of the slideshows that we get from guest speakers and the slideshows we get from the workshops. So everything's in there, including my slides for today. Okay, perfect. So I am going to do a little bit of an intro about what neuroscience is, and then talk to you a little bit actually about a review that I co-published with a few of my peers in graduate school. And then I'll go ahead and talk a little bit about cold emailing. If you have questions, you're more than welcome to put them in the chat, or you can raise your hand as well. I like talking to all of you, so if you want to raise your hand when I ask you questions, you're more than welcome to. Okay, but first, starting off with a very broad picture, does anyone know what the components of the nervous system are? Like what makes up our nervous system in our body? I see Jonica.
I would say like our nerves, and then I would say like our heart because they pump the blood into the heart.
Yeah, that's a great answer. So yes, you're right about the nerves. Our peripheral nerves are definitely one major component of our nervous system. And then Alexander, did you have anything you wanted to add?
Yeah, I could also add that I think usually there's usually three main parts you could say, which include like the brain, spinal cords, and the individual nerves. But I guess it's like the broad general way of how you can describe it.
Then there's also
Yeah, no, that's perfect. So that's exactly what I have here. So we have our brain, spinal cord, peripheral nerves, and then also sensory receptors. So for people that have sensory receptor deficits, sometimes people can't feel like when they burn themselves on, for example, like a hot stove or something. And so sensory receptors are really important because they transmit that information about temperature and pain to your spinal cord and to your brain so that you can make a decision about it quickly. And does anyone know why, for example, when you touch a hot stove, you react really, really quickly in comparison to, I don't know, like tripping over something? I see Salika.
Yeah, the reason is because your spinal cord, like your motor sensors, they go quickly instead of sending signal to your brain. So it's just like part of your reflex rather than you actually processing it.
Yes, exactly. So our reflexes are primarily driven just by our spinal cord, and that makes sense for the reaction to be much faster because instead of a signal having to go from your finger all the way up to your brain, it just goes to your spinal cord. A decision is made there and it's sent right back out to your fingers, to yank it away immediately. And that's very helpful because obviously you don't want to, burn yourself over a prolonged period of time. And so this is just a diagram of what the nervous system is. It doesn't include all of the sensory receptors, but it has most of the peripheral nerves, your brain, your spinal cord, and everything that kind of extends out of this system. And so your nervous system is really important because it controls so much of what you do and it allows you to actually process the world that surrounds you. And so can anyone tell me something that our nervous system is responsible for specifically? And I'll look in the chat as well, but Kevin?
So what I think the nervous system is responsible for is it helps like sense the world around us and like um helps us like imagine like what we like to feel, taste, or touch.
Yeah, it's very much responsible for helping us process sensory information. So things like sight, smell, taste, touch, those types of things. So it helps us process that information that's picked up from our sensory receptors, make decisions about it, and learn from it. And that information is stored either short or long term in our brain. And then in the chat, I see helps respond to stimuli. Yes, movement, exactly. Our brain is what allows us to do things like walk, move your limbs, anything like that. I'm a hand talker, and so the fact that I'm moving my hands right now, all of that movement is being coordinated by my brain. Okay, perfect. So does anyone know what the difference is between our central nervous system versus our peripheral nervous system? I will call on Dina.
Hi, so the central nervous system composes of the brain and the spinal cord, and then the periphery nervous system is the nerves that extend to the
Yes,
periphery.
exactly. And I've seen that in the chat. So great job, everyone. Yeah, our central nervous system is comprised of our brain and our spinal cord. You can think of it as kind of an integration and command center. And so this is where we store all of our information, and where we make decisions too about how to respond to information or what to do. And then our peripheral nervous system is made up of our cranial nerves and our spinal nerves. And so they carry messages both to and from the spinal cord and the brain. There's afferent and efferent uh, pathways that carry messages, take them to and from the spinal cord and the brain, and help us process everything around us. And so this is what it looks like highlighted in pink and blue. You can see the very clear differences between our central and our peripheral nervous system. Both are very important and cannot work without each other. And then I kind of asked this already, but you can type in the chat why our nervous system is so important. It helps us move, it helps us process information. But what I'm looking for here specifically are what are some very vital processes that are controlled by our nervous system and es essentially make it very difficult to even just like be alive if we didn't have a brain. So, what are some very vital body functions that the nervous system controls that are necessary to live? I see Janelle's hand up, and then I'll also look at the chat. Okay, we'll go to Fahimi. Okay, I
Hello?
can't hear. Oh yeah, I can hear you.
Yeah, it regulates our flight and our fight and or flight. That's
Mhm.
important.
Yeah, that's very much important. Thank you. I'll also take an answer from Ellie.
This is kind of more of a question, but like, is it, does it have any connection to like our emotions and like stuff like emotions, like what we feel?
Yeah, absolutely. We have a limbic center deep within our brains, and that's responsible for things like fear, love, all those different ranges of emotions. And the limbic system is actually really, really important and is implicated in a lot of things like mental health disorders and addictions.
Mm-hmm.
So very much important for those types of things. I'll take one more hand raised. So Hayun.
I would also say like heartbeat and pressure regulation.
Yes, exactly. So yes, this is that's kind of what I was looking for, but great job to everyone else. All of your answers were correct. So our brain stem within our brain here, and I'll go back. I'll see if I can go back one slide actually so you can see it. So our brain stem's right kind of at the bottom here. I don't know if you can see my cursor of the brain, and the brain stem is responsible for controlling your breathing. And so without the functionality of your brain stem, you can't breathe. And so obviously not good if you want to live. And that's actually, fun fact, why some addictions or overdoses are fatal because, especially for opioid addictions, the opioid will bind to receptors on your brainstem. And what happens is because there are opioids that have bound to receptors on your brainstem then no longer can actually send the signals out that it needs to your lungs so that you can actually breathe. It acts as a respiratory depressant. And that's unfortunately why patients end up passing away when they overdose. And that's why it's also really important to see if there's any naloxone kits near you. So what naloxone actually ends up doing is it competitively binds to these receptors on your brainstem there. So essentially, it doesn't let the opioids bind to the receptors there, but it itself will bind there and it doesn't have an effect. So because it's blocking the opioids from binding there, then you have less of a negative effect on breathing. So I always recommend that if people have like pharmacies near them that give away naloxone kits for free, that you just keep it on hand. But that's definitely, it's not a requirement. It's just a suggestion. And yes, I'm reading in the chat as well, regulating homeostasis, heart rate, digestion, breathing. Yes, all of these things are very much important. And that's why a lot of time has been dedicated to understanding the intricacies of the nervous system. And even though we've probably been studying the nervous system for many, many decades now, we still really don't know all that much. And so this is kind of the flow of how the nervous system can be broken down into. So we have our central nervous system, which is our brain and our spinal cord, and then we have our peripheral nervous system. And so I think some of you were talking about the fight or flight response, which is great. So our fight or flight response is controlled by our autonomic nervous system. And so this is controlling our involuntary body functions, and that's essentially just prepping you for danger. And so I won't talk about the different lobes of the brain today, just because that'll be covered in our workshop next week. But I did want to briefly talk about the different types of cells in the nervous system. So cells in the nervous system are really unique, as they are to all the different types of body systems that we have, because these cells specifically are excitable. So they transmit electrical signals. Our brain is actually very electric, and that's why you can see signals from the brain on different measuring techniques like an electroencephalogram or an EEG. And so these neurons transmit information to and from each other, and that's essentially how we're able to process information and make decisions. And that's the basis of how our nervous system works. One neuron will become excited, or perhaps it will become inhibited. We can talk about that at like a later date. But if one neuron becomes excited, it can excite another neuron, and that activates kind of a relay system until that information reaches the place where it needs to go. And I bring this up specifically because I want to just briefly touch on the synapse. So in our nervous system, we have tons of different types of cells. We have neurons, which are the primary brain cell, but they're actually not primary in terms of how many of them there are. Neurons are actually quite outnumbered by support cells that are called glia. So these glia help do things like regulate the environment outside of the neurons, make sure there's no like toxins or waste, and they help clear that out. But they also help make sure that the neurons function well. But the neurons themselves communicate to each other by releasing these neurotransmitters that bind to the next neuron. And so some diseases and disorders of the nervous system result from a deficit of being able to do things like this, communicating between neurons. And specifically for today's talk, I wanted to focus on neurodegenerative diseases. So neurodegenerative diseases are exactly what the name implies. It's the degeneration of neurons or neuronal related processes. So I'm sure that most of you have probably heard of Alzheimer's disease and Parkinson's disease. There are actually many, many more neurodegenerative diseases that we unfortunately don't have the time to go into today. But these diseases are so fatal because they, one, primarily show up in aging patients when there's less, healthy brain left. So our brain is really healthy and really plastic very early on in life. And then as we progress, we stop seeing as much the plasticity that we see when we're younger. And our neurons don't actually regenerate or reproduce. They don't divide. They don't undergo mitosis like other cells, like our skin cells, for example. Those cells, they regenerate very quickly. And I think every 7 years or so, you essentially have a new body because it's a new set of cells. But our brain doesn't do that. So we're really born with pretty much all of the neurons we're going to have. And so damage of any type of neuron in any amount could be very detrimental. And so In Alzheimer's disease specifically, there are a bunch of different things that have been implicated in the cause of it, but we still don't really know what's going on. And there's a lot of research that's been dedicated to this over the past couple of decades. But our best hypothesis is that there's this kind of buildup of bad proteins or misfolded proteins within the brain that form these plaques and scar tissue around the brain that prevent neurons from talking to each other, and then eventually, unfortunately, leads to the degeneration of neurons as well. And so the symptoms that you might typically associate that with are memory problems because these misfolded proteins are typically seen in memory areas of the brain. And we also see things like this in Parkinson's disease. So we see a loss of dopamine producing cells. Dopamine is a neurotransmitter. And then we see those different types of symptoms as well. And so what I wanted to specifically focus on with regards to disease is just focusing on why it's so difficult to actually target things in the brain and why it's so difficult to treat brain disorders. So does anyone know why it's so difficult to actually get drugs into the brain or why it's so difficult to make sure that when we have patients with things like brain tumors, it's really hard to effectively target and treat those specific brain tumors in specific regions of the brain? And the answer is partially on the slide here. But yeah, it's our blood-brain barrier. And does anyone know specifically why our blood-brain barrier makes this so challenging? Yeah. Yug or Yug, sorry.
Yeah. So the blood-brain barrier is like a very selective filter that blocks like many substances from leaving the blood and just entering the blood tissue. So that's one of the thing that it is. So that's blocking out the drugs too that you want to inject for treatment.
Yeah, exactly. That's a great point. And so that touches on what I'm about to say as well. But the blood-brain barrier is really the primary reason why the brain is so difficult to treat. And so I'll show you kind of an image here. But our brain isn't just like sitting in an empty space inside of our skull. It's kind of I use the term floating. I don't know if that's entirely accurate, but it's kind of sitting in brain juice or cerebrospinal fluid. But the brain is also very highly vascular. There are tons of arteries and blood vessels that go up and around your brain and kind of wrap around it and form this network. That's really great because our brain desperately needs something that blood provides. And does anyone know what that something is? I will look in the chat too. Ariana?
I believe it's oxygen.
Yes, exactly. And I'm seeing that a lot in the chat as well. So great job, everyone. Our brain needs oxygen to survive. And that's part of why actually doing CPR is so important because CPR actually, when you're doing the compressions on someone, those compressions recirculate the remaining oxygen that's in the body and allow it to get to the brain because every minute that your brain goes without oxygen is very detrimental. You lose so much healthy brain tissue. And so that CPR is really helpful in making sure that your brain stays at least partially oxygenated until you can get rescue care. But yeah, your brain absolutely needs oxygen to survive. And so it's great that the blood vessels do that. But what's not so great is that we have a blood-brain barrier here. And so this barrier, as you can kind of see in the bottom right, is made up of these tight junctions, and it's very hard for things to actually pass through. And that's your blood's way of kind of protecting the brain to make sure there are no toxins going in there, which is great. But then that also means that if something's going wrong in your brain, it's really hard to get any sort of treatment in there. And so researchers have spent the last couple of decades trying to come up with really creative strategies to overcome this barrier. Because as you can see here, there we have tight junctions here, we have cells surrounding it. It's really hard to actually break through that wall and deliver treatments there. And so, what are some of the things that can actually cross the blood-brain barrier? Well, if it's anything that's not a lipid-soluble molecule, so anything with proteins, anything with any sort of polarity or charge, any pathogens, that will not be feasible to pass through unless it's delivered in a different way. but a lot of the drugs that are being developed for the brain are not just lipid-soluble molecules, and they're also very large. Typically, if you want to pass through that blood-brain barrier, it's very, very tight. So you have to have really, really tiny molecules. That's not great if you want to deliver treatment specifically there. And so, yeah, that's why it's been a real big challenge over the past decade or so to trying to figure out how we can actually bypass this so that we can get treatments to the brain where they're supposed to be. And so I wanted to briefly talk about adeno-associated vectors. And so you don't have to have any experience or knowledge of what genetics are. All you just need to know is that these vectors are essentially naturally occurring viruses that we all have in our bodies, and they have this kind of protein shell, and they have the single-stranded DNA genome. Importantly, natural AAVs, or things that are produced by your own body, have a better chance of getting into the brain as opposed to recombinant AAVs, or things that your body might not recognize. Because a huge part of what the brain allows to get in, or that blood-brain barrier allows to get in, is what it can actually recognize as being kind of innate to the body. And so what researchers have tried to do is, especially for diseases that could benefit from the production of specific proteins, so you can switch out the genes, they'll replace an original gene with some gene of interest that would help with treatment, and then kind of stick it back inside that shell and try to send it up to the brain to see if the brain thinks that it's innate to the body, and then just let it back in. And so that's been kind of the focus of gene therapy over the past, I want to say 5-10 years. And so we have one specific type of vector that is the most brain penetrant. And so it binds to these galactose residues on the brain here. And once it can bind to that receptor there, then it's allowed to pass. And so that's great, because if it can bind to that receptor and the body recognizes it, then we can get whatever is inside that capsid to get where it needs to go. But unfortunately, AAV9, which is the best one in our human body, isn't actually that great, because even in adult mice, which are not adult humans, there's only 1 to 2% of neurons that end up getting transduced. And if you have a very large tumor, or if you have very big areas of deficit, 1 to 2% of neurons is not going to cut it. And so a review that I helped publish with some of my peers talked about these delivery challenges of these vectors to the brain, but then we also talked about all of the new vectors that have been made over the past 20 years, and then how effective they are. So I'm not going to go through this giant table in full, but you can see here all of the different advancements we've made in developing new types of gene therapies, and you can also see what types of cells are specifically targeted and how effective they've been. So this research is relatively new. I think this review that we published, and I can share a link if anyone's interested, I think it was published in February of this year, and we worked on it all of last year, but it's in the Frontiers in Neuroscience journal, and I can talk a little bit about publishing as well if anyone's interested. But it's just meant to serve as a brief overview and then go into a little bit of detail of the advancements that have been made in gene therapy, and then talking about, what might actually be helpful going forward. Because it's great to know that, okay, these specific gene therapies, for example, the STAC-BBB one, that it targets brain cells and the spinal cord, but we want to know exactly what cells can be treated, because if we have cortical diseases, then this might be the best recombinant one. And so I talk about a few different ones that were the most effective here. I won't go into super much detail, because you can read more about it in the paper, and I also want to save time for the cold emailing. But there has been a lot of promise in the last a little bit for new and kind of recombinant gene vectors. And as you can see by these kind of these blue bars here, VCAP 102, which is just a specific type of recombinant AAV, it's actually been doing really well in transducing neurons. Transducing neurons is good. We want to make sure we're hitting and effectively targeting as many neurons as possible. And so it's actually been doing a lot better than what we have innately inside our bodies. And so that provides a lot of hope, because the goal of doing this research is to get it to actually translate to diseases like brain cancer and neurodegenerative diseases. Okay, so I've told you a little bit about like the research that was done to get that paper published, but I also want to go into the specifics of how you're actually supposed to get involved with research and shadowing, and then my tips for cold emailing. I think that the system is a little bit unfair to all of you sometimes because I think that it's kind of the expectation, it's a silent expectation that everyone has to go and get research and shadowing, but you're not really told how exactly you're supposed to get research and shadowing. And so that's why I wanted to do this little mini workshop because I don't believe in gatekeeping. I want to make sure that any tips that I've learned over the past couple of years, and I've actually spent the last couple of months talking to clinician scientists as well to see what they like in students when students reach out to them, so that I can share it with you and hopefully help improve your chances of getting a research position or a shadowing position if that's something that you're interested in. So first, I'll tell you a little bit about my research experience, and you're welcome to ask me questions about any of it after the session if any of it sounds interesting, and I can tell you exactly how I got it. But in high school, I didn't do any research really. I was a hospital volunteer, and so I was allowed to like shadow some of the physicians there because I was already a volunteer. Some hospitals do like volunteer programs, especially in the summer. So I would highly recommend looking up hospitals near you and seeing if they run any volunteer programs. And then in undergrad is kind of where I did more research. So I did a lab course, which you don't need any experience, you just sign up for the class, and that was helpful. And then what I did have to cold email and network for, which I'll tell you a little bit about, was my third year research practicum course. So it's just like I did a little mini research project over the course of a semester. And then I also did a fourth year neuroscience thesis project where I helped develop kind of my own project in behavioral and cognitive neuroscience. And so that was over the course of a full year. And then I also was a volunteer in a wet lab for a neurophysiology lab. So I had a little bit of research experience in undergrad, which was very helpful because when I applied to graduate school, where I'm currently doing clinical neuroscience research, I used those experiences when I was reaching out to professors to get a position. And then I'm also working with some other like clinical teams to publish papers about like practice guidelines for older adult concussion. But I'm happy to talk about any of these in specific if you guys have questions, but I'll just go over it briefly. But I really love neuroscience, so I have actually been very involved with the Hamilton and Toronto Brain Bee. I don't know if any of you were in high school in Toronto, but if you were at the Brain Bee this past year, I was there. And if you are living in the United States, Canada, and I think there are brain bees in most countries. I don't know if there are brain bees in every single country. If you're in high school, I highly, highly recommend it. It's just like a neuroscience academia competition for high schoolers. It's so much fun. I did it in back in high school back in 2020 when I was a senior, and I had so much fun doing it. And then other research experiences that I've had include presenting posters at conferences. I've done some talks at conferences as well. I'll actually be at the annual Alzheimer's conference next week. So unfortunately, I won't be able to join the sessions live anymore because I'll be there for the conference, but I'm happy to keep in touch through Slack. But these are the different types of research experiences that you can have even in undergrad. And so I'll briefly tell you about my neuroscience journey. So I watched a Nova documentary when I was about 8, and it was about the brain, and I was like, this is amazing. This is what I want to do. And then in high school, I did Brain Bee in 2019 and 2020. So I'm originally from Massachusetts, so I did it in Central Mass. And then I used that love of neuroscience to apply for neuroscience research positions. And I applied to a lot of universities in the US and Canada and ended up choosing a program based off of the strength and accessibility of just the research that they were doing. And I joined some extracurriculars. So I was a part of my school's neuroscience society. I took a bunch of neuroscience classes. I'm still taking neuroscience classes. And then I did an honors thesis as well. And so for those of you that were here on Monday, when Dr. Hamza Khan was talking about doing his PhD and applying, he mentioned that he had to send out 100 cold emails to get one position. And that is kind of the case. I had to send out 82 cold emails to supervisors across, I think it was actually 3 to 4 different universities. And that's how I got the position that I'm in now. But yeah, it does take a lot of cold emailing. So you've got to persevere if this is something that you're interested in. And then for those of you that are interested in shadowing as well, it probably will take a lot of emails. And so it's very normal. I totally understand sometimes that students get a little bit discouraged when they've sent out like 50 emails and no one's responded to them. I totally get that. I've been there. But I'm sure that if you reach out to enough people, there'll be someone that's interested in taking you on. So yeah, if you're interested in the Brain Bee, I'd highly recommend just Googling either your city or your country and then that plus Brain Bee and seeing if there's a Brain Bee competition near you. Typically, these competitions are held between the months of February and March. So this year's Brain Bee just passed, but this is a perfect time to kind of get involved with the next year's one. You don't need any experience in neuroscience. They publish all the study materials online. You go in person and you do like a written test or maybe an oral test. It depends on the state or the country that you're in, but I'd highly recommend it because it's great to see if you're actually interested in neuroscience, and even if you're not, it's a great way to, get something to put on your CV. And so these are some pictures from when I helped run the Hamilton Brain Bee. It was so much fun. We had a lot of people come out and a lot of high school students in Hamilton participating, which was so much fun. So yeah, I'll leave that there. But okay, so I wanted to talk a little bit about cold emailing. So I've published a guide in the Google Drive. So if you guys could all open that up, that would be great. But it's in the public Google Drive. I'll see if I can actually copy this link and then put it in the chat as well. But yeah, you could all open it up. That would be great. And so in this cold email guide that I've made, I've put a bunch of tips for writing cold emails to people, how to find people near you. And then I've also included my own personal cold emails that have gotten me research positions so you can see what it's like from someone that has done research. I spent the last couple of years kind of really honing in on this specific template, which I think is pretty good. And it's a template that has been kind of validated by other like professors and other peers in graduate school. So I'd highly recommend checking that out. And so there are a couple different things that you want to do when you're cold emailing people. So if you look at this first cold email here, let's say you Google hospitals or universities near me and you find this one professor, you really like your research, so you reach out with this email and it says, good afternoon, hope you're doing well. My name is this. I'm interested in being a physician like you. I like the work that you do, and I'm wondering if you have any shadowing opportunities available for me. I think this is a pretty standard email that a lot of students send out. But what I want to ask you is, do you think this email is okay to send out as is, or is there perhaps something missing from it? And you can read through the guide as well, and I'll give people a minute to answer. But what do we think? Harshit?
So the email as is, can you hear me?
Yep.
So the email as is, it's not bad, but it's not personal. It doesn't talk about the professor's specific work or why you want to go specifically with that professor. So the professor probably would not respond to it or deny it.
Exactly. Yeah. So I've spent the last couple of months talking to different professors and peers in graduate school and just trying to figure out what they're looking for when you email them and then, relaying that information to you. And oftentimes what students will do is they'll just say, "Oh, I'm generically interested in your larger field of work." And there's nothing wrong with that, but that doesn't show a professor that you're actually specifically interested in what they're doing and in their lab. They want to know that you're interested in the research that they're doing, specifically in the faculty perhaps that they're in, and they want to know that you can think critically. So in this next email, what I added was that this pretender, anonymous person or whatever, I wrote this template, but now there's the inclusion of, oh, I read your recent publication, and then I just put the title of my paper here, and a question. So if you ask them a question, you're showing them that you can think critically about the work that they've published. And because you've read a paper by them, they know that you are interested in their work specifically. PIs really want to know that you're interested in their work and their lab specifically because there are lots of labs doing neuroscience research. They want to know that you're interested in the kind of neuroscience research that they are doing. And then there's actually still something missing from this email. And does anyone know what that is? David or Yuk?
Should I answer?
Yep.
I think more of your extra co-curriculars could be added, like your previous work experience, maybe attaching your resume or CV in it.
Yes, exactly. So it doesn't really go into depth about your extracurriculars, and you should typically try to keep things pretty short, but maybe adding a few more things that you've done or a few more classes that you've taken that might be relevant. So you've taken any biology classes or, chemistry classes. Those are often very relevant to doing research. And then it really specifically, it doesn't have your resume or your transcript. So your resume and your transcript are required for everything that you send out. You have a much better chance of hearing back from people if you attach your transcript and you attach a resume or a CV. So that way they can get a look and see what experiences you've had and what your profile looks like academically. And then they use all of this information to make a decision about whether or not they want to accept you into their lab. Okay, perfect. And so this is an email template for people that are interested in shadowing. So if you're not interested in research at all, that is totally okay. But I know that some of you are interested in doing in-person shadowing with physicians. And so this is an email template for that. So you talk about why you like the field of neurology they're doing. If they're a pediatric neurologist, for example, you could talk about why pediatric neurology is specifically very interesting to you. What do you like about it? Have there been any recent advancements in the field that make you excited for the future of it? That would also be great. Does the hospital that this physician works at, are they doing anything interesting in this field that might line up with your interests in the future? So you can do this. And then just in general, I've put these tips in more detail on the cold email guide. So make sure you keep your emails brief. In one of the templates that I included, I think when I reached out to my graduate school supervisors, I think the section that I put in about my extracurricular experience was way too long. I should have just kept it to like 2 or 3 really relevant experiences. So keep it brief. Remember that these PIs and professors, they have lots of different things going on right now, and so keeping it brief will help you get a response back. Making sure your emails to the individuals are personal. And then also see if you can find any common ground or interests. So when I reached out to my undergrad professor for a neuroscience thesis, I had met them at a networking night. And then I noticed that they were interested in like music, and I had played the piano for like 10 or 15 years. And so I used that to kind of find common ground with them. One PI specifically that I asked this year, what are they looking for when they hire students? And one of the things they mentioned was that they want to know that you're someone that would kind of vibe well with them, maybe have some common interests. Because, a big part of when they hire you or why they might hire you is figuring out if you'd be a good fit for the lab culture. So recommend doing that. And then these PIs have a lot of people, these clinicians, these scientists, principal investigators, they have a lot of people reaching out to them. So the more unique your email is, the better your chances are of hearing back. So if a professor has or a physician has a passion project, or they have a social media account, or they have, they've published a book, anything like that, I'd recommend commenting on it as long as it's appropriate, of course. And then kind of using that to establish a connection so that they can get to know you a little bit more personally. And then at the end, put yourself in their shoes. If you were reading the email you sent, would you want to accept you? And I'd also definitely recommend asking for feedback from your friends, your family, literally anyone, and seeing if they would recommend any changes. And then, of course, make sure you're remaining respectful when you send follow-ups. So I would recommend sending follow-ups no earlier than 1 week after the initial email, and then not really sending any more than 2 to 4 follow-ups, because after then you're not super likely to hear back. And some other things I wanted to mention, you don't need any experience to reach out. Ask for advice, ask for feedback. If a lab ends up not taking you on, I'd actually recommend reaching out to them and asking why they said no. Maybe they have some good feedback for you, maybe the timing just wasn't right, but all that information is helpful and will make your chances of getting into the next thing much higher. You can also start small, so you ask for a coffee chat, and then at the next meeting, maybe you ask if there are positions available. But I have all of this detailed in there as well. Okay, so I'm going to stop sharing there, and I'm happy to take any questions for a couple minutes, but I also want to let you all know that there's a homework assignment. And so what we are asking of all of you, and I'll put this assignment in the chat as well. So let me post that here, and then I'll post the submission form. So this homework assignment is due Monday, July 20th. So we're giving you a lot of time to do it. And everything we posted on our website, everything's in our Google Drive. But what we're asking you to do is to send out 15 cold emails in your area. So if you're not interested at all in research or shadowing, see if there are any medical companies, science companies, people in industry, people in genetic counseling and medical sales that are of interest. Reach out to them on LinkedIn or via email and ask if they're willing to, chat with you for 30 minutes. But sending out 15 cold emails by Monday, July 20th. If you're really serious about getting a research or a shadowing position, I would actually personally recommend that you send out closer to 60 emails, but that would make this very much more overwhelming. So we only require that you send out 15 emails, and the format is in the document there. So you just write down all the emails that you sent, and then just whenever you sent them and who they're being sent to. And then we're going to follow up with you after the program to see how those emails went. If you want feedback on your emails, you're welcome to reach out to us and we can provide you with some brief high-level feedback. But we created this homework with your success in mind. We don't really gain anything from assigning this homework, but we want it to be very helpful for you and kind of encouraging you to take the next step in getting a research position or a shadowing position. So highly, highly recommend doing that. If there's absolutely nothing available at all in your area, you can reach out to us. But this is the first homework assignment. There likely will only be one other homework assignment that we will tell you about next week. But yeah, so this homework assignment is due Monday, July 20th. All the links will be posted on our website, in Slack. All of these materials are also already available in our Google Drive, which you will have access to before, during, and after the program. But does anyone have any questions about the assignment itself, or just do people have questions about research? Okay, I'll take some questions. Kelly?
Sorry, hi. I have like two questions, if that's fine. So my first one is that when you mean by like keep the emails like brief, like how like approximately how many like sentences or like paragraphs should
Couple
we?
sentences for the intro, couple sentences for, or one or two sentences for the paper that you liked or the work, and then like no more than 3 sentences for your extracurricular experience. I think for mine, I had like 5 or 6 sentences and it was a giant paragraph, so I wouldn't do that. But yeah, keeping it brief like that.
And also, so I'm in high school, right? So
Mhm.
compared to like undergrad and grad, I don't have like as much as of like like as outstanding like
Mhm.
experiences. So how do you think like do you have any tips I can like make my emails like more outstanding?
Yes, so I have two things. First, don't put in your email that you have a lot of experience and that you'd be a great asset to the lab. I actually heard from a professor in university that they don't like when people reach out to them when they have no experience, or if they're in high school and they say, oh, like I'd be the perfect fit for your lab when you don't have any research, it'd be more of a learning experience. So don't say that. And then the second thing is start out really small. Just ask if there are any volunteer opportunities and just be open to any sort of position. So not asking for a specific like research assistant position or anything, but asking if maybe you could attend their lab meetings or if you can volunteer and help them read literature or just literally do anything. That's how I got my wet lab position in third year. I emailed a bunch of professors over the summer and I was like, I'm happy to do whatever you need me to do. And then I ended up helping take care of some crayfish that were used for a neurophysiology lab. So I didn't do any research in that position, but it was a volunteer position and it was just because I emailed and I was like, I'll do whatever you need. And so just remain really, really open. Um, and yeah, I think those would be the best tips.
Okay, thank you so much.
Yeah, no worries. Also, it's past 11:30 now, so if you want to head out, you are more than welcome to. I'll stick around in case you have any questions, but I'll take maybe 2 or 3 questions and then I'm happy to be contacted over Slack. But I hope that this was helpful for you. I tried to develop this workshop so that it was so that the expectations were really clear and that the advice was also really clear so that you know exactly, what you need to do to get research and shadowing because I know it's confusing and there's a lot being expected of you, but not a lot being communicated to you. So I wanted to help bridge that gap a little bit. I hope it was helpful. But yeah, if you don't have any questions, you're welcome to head out and I will see you on Monday. Recommend getting a head start on the assignment over the weekend. You don't have to, it's just my personal recommendation. But yeah, I'll take 2 or 3 questions and then you can contact me over Slack. So Winnie?
Hey, how are you?
Good, thanks.
My question is basically just like, especially specifically around my area, a lot of places require students to be like 18-year-olds or older. If we're still minors, like what would your suggestion be?
Yeah, so are those requirements for like in person, like if like contact with patients?
Like any kind of volunteering or helping around, like from what I've learned emailing.
Yeah. So in that case, I'd recommend seeing if there are any online opportunities. Those might be a little bit more lax in terms of requirements. So reaching out to see, and also like it might be done on a case by case basis. You might be able to reach out to someone, and if they're okay with you being under 18, as long as you have a parent or a guardian's permission, they might be okay with you like volunteering in their lab. But yeah, so starting in your area and just reaching out to people to see if they have anything that they can offer you. And if not, I try online experiences as well.
Okay,
But I
thank you.
definitely get that it's challenging being in high school and being under 18 and trying to get these positions. So I sympathize with that.
Thank you.
Yeah, no worries. Okay, also I see one question in the chat I wanted to address. So, if I'm not looking for shadowing or research right now because of time commitments, yes, we do want you to send out the emails, but instead of sending out research or shadowing emails, send out emails to physicians or people in a field that you're really interested in getting involved with and ask for a 30-minute or 15 or 30-minute coffee chat so you can pick their brain about how they got into the field, etc. And you can ask them for their personalized advice. That way you're still talking to someone that's actually done what you want to do and you're not committing to anything long term. So still required, but the assignment can be modified so that it's more applicable to your career goals. If you're not interested in researching or shadowing at all, then reach out to people in the field that you want to work in the future, ask for a chat and see how that goes. Okay. Lucas, do you have a question?
Yeah, I just had a really quick one. So when you send a cold email and they actually respond, like what are generally some just good follow-up steps to take?
Yeah, so first I'd recommend responding as soon as possible. You want to like catch them when they still remember you. Um, if they're like, oh, can you meet at this day and this time? Do your very best to meet at that day and that time because their availability is probably limited. And when you go to meet with them, I just recommend reading up on some of their recent research or some of the recent work they've done. This is applicable just to science. So that way you know like what they've just been most recently doing. I'd also recommend if their lab or if they're part of a fellowship group has a website, reach out to the graduate students in the lab or maybe some of the residents that the physician or the scientist is working with to ask what the lab culture is like. Let them know that you're going to be meeting with them. Maybe you can meet with the student like first before you even meet with the PI, because students are often very willing to meet with people. When I was reaching out to professors for grad school, I would reach out to the students in the lab first to make sure that the lab was not a red flag, because sometimes a lab can look amazing on paper and then the culture is very toxic. I was actually almost offered a position in a lab that ended up being like it was just very bad vibes. And because I talked to students, that's how I found out about it. And I was like, okay, never mind. I don't want to do that. Um, but yeah, so talk to students and then prep and then just try not to be too nervous. These PIs know that, meeting them is a little bit nerve-wracking, and so they kind of expect that. But just try to come a little bit prepared for your meeting with them because when you meet with them, they'll be assessing you to see if you're a good fit.
Okay, thank you so much.
Yeah, no worries. You?
Yeah, so my question was about cold emailing itself. So recently I wrote about 60 to 50 cold emails to professors and researchers in my country itself, and I only got a few responses. And I thought that this work was really tiring to just write personalized emails for each and every professional and like just sending out emails in general. So I was thinking to code a script to just send a very personalized email to a list of professors' emails that I just input. So what do you think I should do?
Yeah, sorry, I think my audio cut out for you in the very last part of your question, but I totally get that it's very time consuming. I think when I was applying to grad school, I had spent like 6 months sending cold emails, and by the sixth month, I was like, I'm kind of over this. But I saw it as like an investment into my future, and I did a little bit every day. So I would send out 3 emails every day, and that way it felt a little bit less tiring because I wasn't trying to do like 20 in a weekend. So I did that, and that way, my whole day didn't get eaten up by emails. So I'd recommend doing things like that, but unfortunately, part of it is just like it's going to take some time. I wish I had more like hopeful, optimistic news, but yeah,
Okay, thank you.
yeah, no worries.
Hey, Davina.
Yeah.
Someone had a very good question in the chat. I feel
Mhm.
like this is very important.
Mhm.
Ellie and Shen said that in this scenario where you find you do not want to work in a certain lab, like how are you like able to reject the offer?
Yeah, I actually ended up doing this myself. So I interviewed with a PI that's not in Toronto, and I did not like the way that they did the interview. I actually think that I told them that I wanted to be a teaching stream professor, and I think they asked me, "Oh, are you just doing this research so that you can do that?" And I was like, "Okay, girl, rude." But yeah, I did not like the energy of that at all. And so I emailed them back after and I was like, hey, thank you so much for interviewing me, but I actually don't think this is going to be a good fit. And I wish you the best going forward. You can always reject something before it's official. I know that it's a bit scary to do, but it's so much better than accepting a position where you're not going to be treated well. So I hope that that partially answers the question. But yes, I always recommend if you're doing research, reach out to the people in the lab beforehand if you can, ask what their experience is like.
Can I just add to that really quick, Davina?
Yeah.
Yeah, so I've actually gone through this too. So I was working for a research lab and applied to another one like part-time because it was a lab I was interested in. And remember that when people interview you, you're kind of interviewing them too. So, yes, like show up and, demonstrate why you're an impressive candidate and express genuine interest, but really pay attention to what people are saying to you and come with questions like genuinely for yourself, navigate the line between being professional and asking good questions and seeing what your needs are. And for me, the lab was really awesome, but I had to turn it down because I realized it was an unpaid commitment. And at that time, I realized I couldn't do full-time work and then unpaid lab research. And I had a really good conversation with the person that interviewed me after. I actually asked for a follow-up meeting to like just ask a couple more questions, and then I had to turn them down. And they were really nice and understanding about it. Just be professional and be polite, and just as long as you do it before your position officially starts, give them adequate notice. As soon as you know you cannot do it anymore, just let them know right away.
Yes, that's a great point. Actually, Tamina, you reminded me I should add that to the cold email guide. Tips for when you actually schedule that interview. And I totally agree with you. You're interviewing them as much as they're interviewing you. When I was applying to graduate school, I met with professors, I asked them questions like, what is your mentorship style? How hands-on or hands-off are you? How much interaction time do you have with people in the lab? If someone wants a one-on-one meeting with you, are they able to get that? What is the support like that's offered in the lab? So I asked all of those questions, and I think that that was very helpful because sometimes people have really good answers to that, and sometimes people do not. So I will add that to the guide as well because I think when I was creating the guide, it was mostly focused on like getting that first meeting, but I'll add that part in for, once you maybe have a meeting with someone. Okay, Tatiane.
Hi. So,
Hi.
I just wanted to ask on the cold emailing part. So, like for example, because I'm a incoming college student, undergrad. So, if I were to like use this opportunity to also like talk to people from like LinkedIn and asking them for research experience, would that kind of count towards the homework assignment?
Yeah, as long as you're sending out like messages that are pretty detailed and not just, hey, I like your position, can we talk? Like if you're doing pretty much the same content that would be covered in an email, that's fine.
Okay, thank you.
Yeah, no worries. Fahimi?
Hi, can you hear me?
Yes.
Okay, my question is about Alzheimer's. Do you know if they have a current research showing like the prolonging life of a person who have Alzheimer?
So what do you mean by that? Like, what do you mean by the prolonged life?
Like extend their life just a little bit more in terms of maybe physical care.
Oh, like increasing life expectancy and then maybe interventions that could result in an increased life expectancy with Alzheimer's disease. I
Yeah.
don't know if there's that research, but Alzheimer's is a huge, huge field. Like for the conference I'm going to next week, it's a massive, massive conference and it's filled with people that are coming in from all over the world. So maybe someone has addressed it, but I think maybe if you do a Google search or, type your question into Google Scholar, you can see better if someone has investigated that.
Okay, thank you.
Yeah. Rumiza?
Hi, thank you. This was all really, really helpful. But I wanted to ask about the difference between being an intern, a research assistant, someone who's shadowing, or a volunteer. Like, which one would be the most optimal to seek towards and tailor the email towards as well?
It depends both on what you want and the experience you have. If you have previous research experience, you have a better chance being like a full intern, a summer employee, a research course student, a thesis student. If you have no experience, you probably would have better luck with being a volunteer, maybe an unpaid intern, that type of thing. So yeah, it depends on the type of experience that you have, and then, based on what you have, I would tailor that email according to those things in past experiences, and just like making sure that you keep the email very open because sometimes if a professor reads your email and you say, I really want to be a thesis student in your lab, and they don't have the capacity for you to be a thesis student, but they do have capacity for a volunteer, then you might not hear back. And it's not because they don't want you, it's because they think that what you want and what they want aren't aligned.
Okay, thank you.
Yeah. Olivia?
Hi, thank you so much for your presentation, all your tips. I just had one question about your research experience. Was it mostly wet lab work or was it more computational?
My research was mostly dry labs. So, for my undergrad thesis, I created an experiment for people that had a developmental stutter. And so they would do like a rhythm tapping experiment, and it was on like this little square touchpad, and then that would record like the taps in synchronization to like a beat or something. And then it would get sent to a computer. I would get that data and then I would analyze it. So I was interacting with participants, running the experiment, and also looking at the data. And then in grad school, still also dry lab, unfortunately. I would love to do some wet lab work in the future. I think the only wet lab experience I have right now was when I did the volunteering that I did in undergrad. But yeah, mostly dry lab.
Oh, okay, thank you.
Yeah, no worries. Also, for those of you interested, it's much easier to get dry lab experience than it is to get a wet lab position because wet lab research requires a lot of training. Grace?
Hi, thank you for your presentation. I really thought it was nice for the cold emailing. My question was like sometimes doctors aren't like very open about like giving emails. Like, so how would we find emails for the doctors?
Yeah, so this would either need to be like if they have a university profile, typically there's going to be an email for them there, or if they're a part of a hospital, a lot of hospitals make their physicians' emails public, so you can reach out to them there. If you really can't find them there, then I'd recommend LinkedIn. Sometimes they have like a professional Twitter account that you can reach out to them on. Sometimes you really won't find an email for someone, but I've found that like if you live in a decently populated area, like you'll be able to find emails for at least a lot of the people you're interested in.
Thank you.
Yeah, no worries. Okay, are there any questions in the chat that I haven't addressed? Yes, you need 15 emails, so you have to copy and paste the 15 emails or LinkedIn messages that you send out by Monday, July 20th. Kelly, any other questions?
Sorry, I did have a quick question. Like for the section about your interests in like clubs that you're involved in, do you have to like for depending on who you're writing to, do you have to tailor your like interest kind of like more
Mm-hmm.
related to their research?
Yes, great question. Based on every cold email I sent out, I would modify what I was specifically
They probably
interested in and like make
was
it
talking.
specific kind of to like what they the research they were doing was. Yeah. So I did have to like shift it around for each cold email, and that's why it is very time consuming because you have to really send a personalized email to everyone.
Okay, thank you.
Yeah, no worries. Okay, I'm going to post all of the assignment details on Slack and in the website. If you have any questions in the meantime, you're welcome to reach out. My response time will be a little bit slower because I'm flying out later today for the conference, but I will get back to you. And I hope that this was helpful. I hope that you learned something. I know that reaching out to people can be very overwhelming, and I hope that this made that process a little bit less overwhelming. I believe in all of you. I know that you can get any research or shadowing experience that you want. You don't need any experience. And so I hope it was helpful. Okay, awesome. I'm going to go ahead and end the meeting. We will see you all back here on Monday for week 2 of our program. I hope that you enjoyed week 1, and I hope you have a great rest of your weekend. I will see you all later. Bye, everyone.